We're back in session. First item on our afternoon agenda is an information item simply to review the consent agenda. Cindy has kindly referenced our page number in our full agenda, where that is if you haven't already looked at it. So look at it. We'll be putting it up for approval tomorrow, but it's just a review. And then second item is the MU Healthcare Annual Report. And I believe Hal?
Thank you very much, and thanks for the opportunity to address you and give you an annual update on how we're doing at the MU health system. And as in the past, I'll talk to you a little bit about the size and scope of what we do. I'll give you some information about quality measurements. We'll talk a little bit about finance, and we'll talk about some new facilities that we're working on. I'll also talk to you about challenges that academic health systems like ours are facing and what we plan to do about it. And I think I got about 15 minutes to do that. I'll also give you a little update from our previous meeting last November about where we are with our risk assessment process, which was of interest to many of you. So one thing to know, you already know this, but the Board of Curators is, of course, the fiduciary organization for the University Hospital and Clinics and the Health System. But about 3 years ago, we established a board, an advisory board, and I want to point out that President Wolf, Chancellor Lofton, and Curator Henriksen are a member of that board. And I would say over the last 6 or 8 months, we've really hit a good stride with that board, where they're providing us with a lot of challenging questions and good information. Folks on the board have, aside from the university and the curator, I think we have people with a lot of expertise about business and healthcare, and people who understand Mid-Missouri's communities very well. And it's been a great relationship. They give us advice on strategy. They give us feedback on our quality performance and our fiscal performance. So to give you a little sense of our size and scope, this is, I won't go over the numbers, but I will say the bottom line on our 2014 revenues crosses $1 billion. And those are the size of the beds and the discharges we have. Just, it would be worth knowing that this puts us, we're not a large academic health center. That's consistent with our geography and demography. We're about the 30th to 35th percentile for academic health centers across the United States. However, we're about the 85th percentile for an acuity index, meaning that we take care of really sick people from all over Missouri. And about 60% of our patients actually come from outside of Boone County, which gives us some special responsibilities, but also some special challenges that we'll talk about a little bit later. So that's the size and the scope of what we do. We have about 515 physicians and a lot of reach in mid-Missouri, but we do admit patients to our hospital from every county in the state every year. So I always like to talk a little bit about facilities. In the upper left there, that will be our new South Providence, that is our new South Providence building, which will be occupying sometime in the middle of January. About 100,000 visits a year we project for that facility, about 50 physicians and other providers, and about 100 employees. We will be sunsetting some old clinics that we have and consolidating some care in this one. In the right upper quadrant is a extension that you all have approved for the Missouri Orthopedic Institute. When we first considered the Orthopedic Institute, it was a request for $85 million from our orthopedists. We decided to do a little test case on that, built a $55 million building, and as they always are, the orthopedists were right, and 3 years later, we're ready to add on. That building will be breaking ground on that building in February. In the lower left, we opened a newly remodeled specific children's emergency room at our Women's and Children's Hospital. And the lower right, we have a wonderful new pediatric rehabilitation center at our Women's and Children's Hospital. Not included on here is actually an expansion of our neonatal intensive care unit. So you can see that we're growing in Columbia, both on the outpatient and the inpatient side, and some highly specialized services that aren't offered between St. Louis and Kansas City. I have promised to tell you about something about our quality work. You should know that, that we have dozens and dozens of different quality measures we follow. Our advisory board meets about these quarterly and gets a much more full scope, but I want to tell you about three things today. This is a mortality index. It's a rolling 12-month index, and we compare ourselves to the University Health System Consortium. Those are peer hospitals around the country. It's a moderately complicated slide, but I'll just tell you the gold bars are our performance. The red dotted line is our goal. And way out at the end, the last several months of 14, we've actually hit our goal, which is to be in the top 25th percentile, which is the lowest 25th percentile for mortality rates when compared to other academic centers. So that's a very good, that's a very, very good performance. You should be proud of that. I certainly am. And our Office of Clinical Effectiveness is so proud of it. In fact, their plan next year is to hit the top 10% in the country, and we'll see how that goes. You'll find out next year. I also promised to tell you where we have areas where we're not hitting it out of the park every single day. We're doing a good job with our all-cause readmissions. You may read in the newspaper that the Center for Medicare and Medicaid Services and others are very interested in hospital readmissions. We have a very robust plan for doing this, but it's a difficult one. We made about a 3% improvement over the last year. We have not yet hit our target. We have a new target for 2015, which is even better. So a lot of people working on this. It's a special challenge for an academic health center in the middle of a rural state, because when about 60% of our patients when discharged don't go back to one of our own primary care providers or a specialist in our institution, but they may go back 2 or 3 counties away. Yes, sir?
Going back to the mortality
Yes.
rate, what is that ratio?
So that's an O to E, I should have explained that, is observed to expected. So if we were average, it would be 1.0. So we know the mortality rates that there's a very sophisticated, we don't do it, it's done with the University Hospital Consortium, a very sophisticated way to average mortality rates. So we know for a certain diagnosis code and the acuity of that code, like how likely is this person to die, you average that across hundreds of thousands of discharges across the country, and you have an observed to expected ratio. If we were average, that would be 1.0. If we were 20% better than average, that would be 0.8. That's about where we are. We're a little bit better than 0.8.
Well, that makes sense, because when you said 25%, I thought that 25% of the people walking in the door die. I knew that wasn't the case.
Well, actually, 100% of them do, but it takes a while. Yeah, right. Yeah, you're right. So that this is a ratio. It's a way of it's a way of sort of leveling the field with your comparators. So I explained this one. We're working hard on this one. We have a great group of people working on it. I'm absolutely confident we'll continue to drop those numbers, but we'd like to drop them a little further. This is only not just about good patient care, and those of you who are in the biz recognize that we have pressure on the length of stay. That is, we have pressure to get patients out of the hospital sooner, but if you get patients out of the hospital too soon, then they're at risk for coming back. This one is an interesting one I showed you last year, and there's a lesson here which I'll go to. So way back, these are 2 measures of patient satisfaction which are out of our main hospitals, and one is a hospital rating and the other is a patient would recommend. These are value-based purchasing indicators, meaning these are important things for the Center for Medicare and Medicaid in evaluating the quality of care we provide. 2009, about 5 years ago, we were at the 22nd percentile and the 46th percentile. Last year, I boasted to you that we were at the 83rd and the 80th percentile, and that we would continue to get better. And we did in some ways, but percentile-wise, we didn't. And this is a kind of a good thing for people to understand across the country. So our actually hospital rating score in 2014 was higher than it was in 2013, but everybody else's went up even more. So we went, even though we improved in the hospital ratings, we went from the 83rd to the 79th percentile. Now, the 80th percentile, the 75th percentile is still pretty good, but we're kind of looking for the upper quartile, and when we get there, we're looking for the upper decile. So we have a really great plan. We're bringing in a physician named Stephen Beeson to work with about 50 of our doctors. We have a number of other ways of improving patient satisfaction. This has been it was a real challenge to turn these numbers around, and thank you to Mr. Wasden and our physician leadership and others for making this happen. This is a great story, but the end of the story is, it turns out if we do as well as we did last year, we're going to slip relative to other people in the country, that's one of the things that's making health systems better. A couple of slides on finance. I always take this slide back to 2000 because I think people kind of believe that hospitals couldn't lose money, and in fact we did back in 2000, 2001, and 2002. And if I'm not mistaken, the average hospital in the United States in 2014 was a break-even proposition. So there are a lot of hospitals that are actually losing money under the current environment. After working with Kaufman Hall back in 2009, and with a mind towards keeping our Moody's ratings in the A range, we're kind of shooting for 35 million, but we don't always get there. Our budget, we have actually the last, since about 2006, I guess. The dotted line at the end is our budget for next year. I can answer questions for you if you would like about how we arrive at our budget. In general, if you were to go around the country and talk to health system administrators, this would be pretty good stuff. This is the one that we lovingly call the board slide. So this is a nice consolidation of financials, and particularly as it rates to Moody's A-rated. So from the top there, we had about $733 million in net revenues, more than we budgeted. Our expenses were higher, and that's because our growth was about 3.5% or 4%. So as long as we keep growing, it's hard to keep taking the costs out. We had better non-operating revenues, thank you, Mr. Richards, than we budgeted, and so in the end, these are unaudited numbers, by the way, and these can change, and actually we know that these are going to change, but we'll be about $36 million change in net assets, and our budget was 17. Don't want to belabor this one, but on the left was our actual performance in 2014, and far on the right is Moody's A-rated, which we would like to keep. That's good for us and good for the overall university in terms of its ability to bond. So those are good financial numbers. I'm happy to answer questions about them. I'm not a CFO, but I can answer most questions if you have them. I think these are good numbers. Could they be better? Probably so, but we're working hard on them, and those are numbers to be proud of. And thanks again to Mr. Wasden, who's in the back of the room. So about a year ago, I came to you and said that Mr. Richards and I were working on a different way of making risk assessment and trying to leverage the strength that we have internally in the health system with our Office of Corporate Compliance, with the strong partnership that we have with PwC. So we made a major change and created a corporate compliance internal audit committee. And I recognize that to boards and other people, formation of another committee at a university isn't necessarily a good thing, but I show this to show that we actually, the membership of this committee are very high-level university executives. So the CFO of the health system, the CFO of the University of Missouri system. I'm on it, as is the CEO, Mitch Wasden, and the Dean of the Medical School, and then there are several ex officio members. The point is that we really moved the oversight of our compliance up to a high level. And this is what happens. We meet quarterly, and we approve the health system risk assessment, and the creation of that risk assessment is a joint effort between our Office of Corporate Compliance and PwC. You hear a little bit more about that this afternoon. We approve the compliance plan, and we coordinate the PwC audits and OCC audits, so we're getting the maximum leverage out of the amount that we're investing. We provide input to PwC during the annual risk assessment and the audit planning process. We get regular updates on reviews performed within our system by the Office of Corporate Compliance. We review the audit findings from PwC and the management response, and we give an annual report to the board, which is what this is right now. So we have been through about a half a cycle of this, and I think we will be even better next year, but I'm personally thrilled at the effort that people put in to really try to understand where the risks are, what are the things that PwC can do the very best, and what are the things that are done a little bit better by our internal compliance group. And that group is working very well together. And thanks to Tom Richards, I don't know if he's here, but thanks to Tom Richards for, there he is in the back. Tom pushed on this, and I think this was the right thing to do, and I think if I were a curator, I'd feel better about it than I did 2 years ago. But I'm not a curator, so you'll have to decide. So here's 4 pride points. We grew patient days by 3%, discharges by 3.9%. In context, in our state and the nation, that's usually a negative number, about 5%. We've grown every year. We've grown or stayed stable for every year for the last 5, which is not the common experience. I'm happy about that. Lots of work by Mr. Wasden and our physician leadership to make that happen. Ellis Fischel became the first academic certified member of the MD Anderson Cancer Network. You've heard about that before. That's an important piece of work for us, and we're really pleased with what that's going to bring us. MU Healthcare was the 9th in the nation, and perhaps more importantly, the first academic health center in the nation to achieve stage 2 in meaningful use. In the biz, that's like the highest level you can get in the electronic medical record and the use of information technology. I think there's really only one major award we haven't won yet, and that's the Davies Award, and I hope next year you'll hear that we won that. I anticipate that next year you'll hear that we've won the Davies Award. This is really, this information technology has been very helpful for our health system in a lot of ways. And finally, you've heard in the past, because it's so important to develop these relationships, particularly in the counties that surround Boone and our health system, we've developed some close relationships with other hospitals in the area. The Health Network of Missouri was officially announced early this summer. We have 5 members, and 3 days ago at our Board of Members meeting, we approved a 6th hospital, so we have 6 hospitals, and you hear more about that. That's part of, I'll explain more about that later too. So my pledge to the group was to spend, to the curators, was to spend most of the time talking about the healthcare delivery side, but I wouldn't want you to think that health sciences research is unimportant at all. In the health sciences area, we had about $54 million in total grant funding in 2014. That included about $19 million in NIH grants. You might think that's a really big number. Our number should be at least 50% higher than that for where we are, and we're working on that. It's a big priority of the chancellor, as you know. We have 2 grants that we're in the middle of. They're the biggest grants that the School of Medicine and the School of Nursing have had. Their totals were 13 and 14 million for those 2. They are really about improving the way healthcare is delivered. We also have a $4.5 million grant that formed the MU Center for Patient-Centered Outcomes Research. So one of the hot areas for funding in the United States is looking at patient care outcomes. These are, if we treat patients as a group this way as opposed to that way, do they do better or not? Different from strictly clinical research and really quite different than basic science research. So some successes there. Last year, and in fact the year before, I told you that the biggest challenges to the academic health centers, and yours in particular, were uncertainties about the Affordable Care Act, and I would say that's still a challenge. We don't know for sure in Missouri where we're going with Medicaid expansion, and we don't know for sure nationally where we're going with the exchange program, but most people believe that a lot of small employers and even large ones will be using the federal exchange for their health insurance. You may or may not know we are part of a narrow network with Blue Cross Blue Shield for the exchange. This was a toe in the water, but gave us some experience in understanding how to manage that. Decline in our revenue sources, no whining, but for clinical care for the same amount of work, we're getting paid 2 or 3% less. And those of you who read the newspaper know that we actually have, in the United States, bent the cost curve in healthcare, starting to come down, and we're happy about that. Somewhat painful, but it's the right thing. And there's lots of competition out there for all of our missions. I want to talk a little bit about the concept of population health. This is the phrase that's being used to describe, so what's at the end of health reform? What does that look like? Population health refers to the idea that a health system like ours will be responsible for a certain population of lives, whether it's a geographic population like a county, or more likely a population that is paid for by an insurer, like the University of Missouri or Medicare or Medicaid. So we have worked, I have a little report card that I keep by my desk, and it helps me keep the eye on the prize. We have a bunch of things we've been working on since 2010. We're making some quite good progress. So the first thing is to develop a vision and some expertise in our organization. We've done that. Lots of people with lots of good understanding about where we're headed and where the roadblocks are. We're fortunate in having a very good HIT system and a lot of HIT competence. Nonetheless, the next line, accountable for quality and cost. There are very few health systems in the country that are actually able to understand what the cost of care, what it costs to provide care, and what the cost is actually to consumers, and very difficult to understand what utilization is within a population. Those are things we're working with the Tiger Institute and Cerner on, and within 6 months we think we should be able to understand a lot more about that. Key relationship development, I've touched on this before, so that really has a lot to do with the hospital, our hospital and our doctors working better together, our hospital and other hospitals, and our hospital and other physicians. And we have a number of initiatives about that, and I think are making good progress. Then there's a lot of delivery and payment model changes that are happening. So more of a emphasis on primary care, and we've expanded our primary care offerings. New partnerships between employers, and we're making a narrow network partnership with the University in Columbia, trying to provide a higher quality of care for less cost, and for us to be able to learn how to do that with our cousins. We also are experimenting with narrow networks. We have 2 of them. We are not doing any shared savings programs right now, but we have certainly an eye towards creating something that looks like an ACO in the future. We think that the federal ACO models that are out there are probably not going to be where we'll be in the future, nor will the rest of the country will be. But we are understanding that we'll need to create the scale and scope in order to do that. So speaking of new delivery models, I've mentioned some of these, but I want you to understand why we're doing these things. Our goal really is to figure out a way to deliver the best care at a local level for the least cost. And all 4 of these things I'm going to show you here briefly really attest to that. So the first one, you know about the MD Anderson network. So we'd like people in mid-Missouri to be able to get the same kind of care that they would get if they flew back and forth to Houston, and actually that's working very well for us right now. We have a lot of our oncologists and the MD Anderson oncologists have a tumor conference every Tuesday. I've personally had 4 or 5 patients that have benefited from MD Anderson's input without having to fly to Houston. That's been a great thing. In the upper right-hand corner, we opened 3 quick care clinics associated with the Hy-Vee supermarkets in Columbia. In the past, we would have not thought that this was a very good idea, but in general, the idea of having a freestanding quick care clinic that's not associated with kind of a higher level of care is a little bit concerning. The good news is we've been able to hire some great providers. They're backed up by a physician executive director, and they're on our electronic medical record, which means that when my patient went to quick care last Monday, Tuesday morning I had the electronic record posting and knew that they had been seen there. In the lower left, this is one of CEO Wasden's passions. So we're working really hard to try to provide health care to people without leaving their home, for example. So e-visits, video visits, making your appointments online, for example. For many years, we've had a patient portal where a patient can communicate with his or her doctor in a secure fashion. Our patients can go online and look at their laboratory work. Right now, in the last 6 months, you can now schedule an appointment with a university physician online, sort of the open table way of doing things. And we did our first e-visit with a video about a couple of weeks ago. Lots to do there. And in the lower right-hand corner, we are so serious about this that we've decided to sell coffee. Actually, that is the logo of the Health Network of Missouri, and this is another way we're trying to partner with other hospitals and physicians and understand how we can help them keep patients healthy in their environment, but when they're sick, we would like to be their partner. So a year in summary, we're doing a good job financially. I think we're strong because we've been able to grow and we've been able to control costs to a large extent. Our quality and satisfaction indicators are a lifelong quest for all of us, but they're looking good. We have a very good alignment of doctors and hospitals, and that's an important success for an academic health center in the future. And I think we have some well thought out plans for our future and what changes we need to make. So those are my prepared comments, and I'd be happy to answer questions if you have any.
Questions for Hal?
If you and others are correct that there's a shift to the Affordable Care Act as the provider, or more accurately, maybe the source to the provider, what is the impact of that on the hospital?
So in general, there's a financial impact, which means if we now have patients that we cared for in the past that didn't have any insurance, that's a positive financial impact. If, on the other hand, we have a number of patients that switch from a very good-paying commercial insurance plan to a less good-paying federal exchange program, that will not be so good for us financially. But in our biz, like everyone else, there is a thing about volume, so we're interested in getting that volume, even if the payments are a little bit less. The exchange programs also come with fairly high expectations about measuring quality of care and measuring cost of care. So in the long run, that's good for us because it'll help push us down that road. There are some places in the country where the local experts believe there will be very little in the way of commercial insurance in the future, that it will mostly be exchanges because it's going to be cheaper for most people. So I don't know exactly how it will impact us. We have, and it kind of depends on how many people sign up when and which people those are. And it's, even the smart handicappers haven't been able to predict that just yet. Does that help?
Yes, so basically, if there is broader coverage, you're probably better off as a provider.
So we are, as a safety net hospital, we care for a lot of people in the, well, for all over the state, but certainly in the middle portion of the middle hourglass of the state. And to the extent that we don't get paid anything for those patients now, this will be helpful. That's right. I think in general, this should be better for us. The Medicaid's that's a more complicated issue.
Yeah, right.
I think you get, Hal, aren't you under an incentive program where you get a reimbursement from Medicare or from federal health officials if you can show them you save money on Medicare? Have you received any of those incentive reimbursements?
So there are several different kinds of penalty reward programs. Right. So for example, under the readmission category, or all those things I showed you about value-based purchasing, so you do a little better if you do well in those, and you do worse if you don't. So in general, we haven't hit any penalties in those. We've done pretty well. I wouldn't say we're making a ton off them. I mean, the idea, of course, is for the federal funders to improve the quality and decrease their costs. So it's not as though people are going to make more money for doing better care. You're going to have to do better care to get what you got last year. So that's one thing. The other issue about the Affordable Care Act and lots of other private insurers as well really has to do with rewarding for better care and rewarding for saving. That's called a shared savings program. We're not entered in any of those right now, so there's a two-sided and a one-sided risk. In other words, if we contract with an insurer or with Medicare to say, we'll split the savings with you, that's kind of good, but we're also splitting, we're also saving them money and we're getting a little bit of it back. So that it is a way to limp into the future. It's not the future, though. I mean, that's something different. That's probably something that looks a lot more like capitation 5-10 years from now.
I understand in the future that the patient satisfaction and HCAHPS measurements will have an increased amount of incentives or penalties. And you mentioned that I couldn't quite understand, but is your plan for improving patient satisfaction based on bringing someone in to work with physicians whose individual patient satisfaction could stand improvement?
That's right. Actually, we have the person in charge of that in response to my query sent me a long list of them, and I don't know all of them. But bringing in Stephen Beeson is one of them. That's the one I talked about. So he'll be meeting with 50 of our leaders, physician leaders, who then afterwards will promulgate that idea. He's been here before. He's great. That'll help. We're in the middle of rewriting our physician compensation plan. I shouldn't say we're in the middle. We're at the beginning of a process to do that. So it's likely that physician compensation in the future will depend more on patient satisfaction. That has some risks on both sides, as it turns out. There's pretty good research about that. There also, I think, Mr. Wasden within the hospital has a very a helpful theme on what we call the culture of yes. And so there's a lot of, we do what are called rounding. So most of the hospital executives go around with individuals and try to understand what it is that they're doing that are positive from patient standpoint and negative. So we have really a lot of things going on, Curator Phillips, that way. Those are some. I'm happy to send you more if you'd be interested.
Are your, that was a good explanation, thank you. The quick care clinics in Hy-Vee, is that a pilot project, or have you latched onto that as a primary care type of funnel back to the hospital? And most importantly, what supervision do you have? Are there physicians who, if not there, are on call? Do you ask whether somebody's come from Liberia and whether they have a temperature?
I sent out that notice yesterday. Yes, we do. So all the people who staff the quick clinics are either nurse practitioners or physician's assistants. Dr. Sue Pereira is the medical director. She audits a select number of their charts like every week. They have a direct line to her or whoever's on call in the primary care clinics. And they also have an electronic communication. So I think our ability to supervise that is actually pretty robust. We don't think of this as a pilot, and this is part of trying to figure out how do we create an environment with the least cost to the patient and the most convenient for things that are not, I'll just say not, have a very low likelihood of having a significant health outcome. So that's what those are for. That also, in some ways, unclogs our primary care clinics, so our physicians in those clinics can spend more time working on diabetes and heart disease and the other kinds of things that they are probably uniquely prepared for. This is one of the things that everyone is working on, which is to try to get people to work at what they call the top of their license, but also supervised by someone who is ready to help them out when they need something. And we are concerned about the Ebola virus, and I think it's not very likely that we'll have somebody in mid-Missouri with it, but we have a great staff of 8 ID guys who will know exactly what to do. But to your point, it turns out that although Ebola virus is very characteristic once it's well established, the first few days look like pretty much anything else. So we're requesting that people, that our providers query, anybody with a febrile illness, have you been in West Africa in the last 3 or 4 weeks?
Are those operations break even, or are they a net cost or a loss leader?
Well, they've only been open for about 4 weeks, but we anticipate that they'll break even. Yeah.
Other questions? Hal, thank you very much.
Thank you.
Very
Thanks
good
very
report.
much. Thank you.
And mostly good news, so thank you.
I will bring you bad news.
We know that. Next item on the agenda is the Finance Committee, and even though we have an extraordinarily efficient chair now as opposed to what we've had in the last few years, it's a very ambitious agenda to try to get done in an hour, but Chair Covington, proceed.
I'm sure I could never fill your shoes. This is the first meeting for Vice President Brian Burnett, first board meeting. And so we welcome you, all of us, and ask you to present, first of all, the FY 2014 Financial Status Report.
Thank you, Chair Covington, and I just want to say to the Board of Curators and all the folks in the University of Missouri family, I'm very grateful for the warm welcome as I end my 6th week here as the Chief Financial Officer, and it's a tremendous staff, and it's been great to visit the campuses and get to know the leadership teams on each of the campuses. So it's my pleasure to report to you today on the financial results from the last year that I had nothing to do with, but I'm happy to tell you that I think you're in a good position, and we're in a good position going forward as a university. So in your packet is under Info 1, we gave some definitions for this. We just walk very quickly through the balance sheet if you like. The good news is you have a net position exceeding $4.1 billion. And what we did on this chart here was kind of give you the categories. It looks like we've got some things that didn't come up there, the category name, but little PowerPoint issues. But essentially you have assets of $7.2 billion, liabilities of about $3.1 billion, and a net position of $4.1 billion as we head at the end of June of this year, which is the fiscal year. The big things to know on the statement on the balance sheet for the university is we're really trying to reduce the cash that we have, and you might have seen that up at the top of the balance sheet. Why? You're earning next to nothing on cash, and I think Tom Richards and our Treasury have done some very innovative things to try and take our cash balances to only what we need to operate and pay our bills, and let's get some income back on the cash that we have. So that's one big piece you may have seen on the balance sheet. On the second page of the balance sheet on page 1-4 of your agenda, you might have noticed a new item in 2014 for unearned revenue of $9.8 million. That was actually some good news we just received recently. That is a 1603 grant that was granted to MU for the biomass project at their power plant. And we weren't sure how much federal support we were going to get for that. We'd asked for $17 million. We're still working on if we can get that number a little higher. But that $9.8 million will have to be amortized over 30 years under accounting principles. So that's going to show up for the next 29 years when we report to you. We will also talk a little bit about the net pension liability, and that will be affecting your bottom line this year. And I know that there were briefings to you, at least I understand there were briefings to you earlier this year about being early adopters of GASB 68. But essentially, the Government Accounting Standards Board, which oversee public universities like the University of Missouri and how we do our financial statements, has mandated that pension liabilities need to be on the balance sheet for universities. We're going to be one of the early adopters, and that'll affect our ratios earlier than peer institutions. But so far, the response from the marketplace, particularly as we're getting ready to issue some long-term debt that's already been approved by the Board of Curators, has been very, very positive from the investing community that we're early adopters, we're early leaders. So we'll talk about that here briefly. Again, our new pension standards will separate accounting and retirement funding, and we have a piece called market value of our plan assets minus your total pension liability equals your net pension liability, which you'll now see on your financial statements from here on out. And essentially, in the third bullet there, we're placing a $254 million pension liability on our books. And what that'll do is that'll increase the volatility each year as we bring you our financial statements, because investment returns, how much is contributed to the pension plan, how much we're paying out as people age out and retire out, will start to create a little more noise in our pension, in our whole pension plan, but also on our balance sheet each year. We are not adding how much we're paying into people's pension. We're not making any changes about that or any of that. It's just really how the accounting world wants us to recognize this liability long-term. So the 5-year trend on the balance sheet remains strong. You can see total assets have grown every year to over $7 billion this year over the last 5 years. The total liabilities were growing as well, but you can see this spike in 2014 because of this net pension liability I just described. So while we were up, moving over $4 billion in net position, we're down a little bit this year because of this adoption of the net pension liability. But I would expect, if we continue to have good operating results, both at the university side and in the healthcare side, which you just heard about from Hal, we should be able to keep that trend moving up and have our assets and net position moving in the right direction next year after we make this change this year. So we've also had a very good year. In fact, the next presentation from Treasurer and Chief Investment Officer Tom Richards will talk to you about the investment growth over the past year. As you know, we invest both our pension assets as well as the endowments of the university, and those have contributed some very strong results for the bottom line of this university over the past year. We also want to continue, obviously we're in historic times about long-term debt and what long-term debt costs institutions like the University of Missouri. We want to continue to use that to our advantage to build needed facilities for our campuses when the interest rates are at historic lows and take advantage of the very, very strong bond rating of the University of Missouri. So this is the kind of a net change for the last 4 years. But you can see we were growing our net position each of the last 3 years, and this year we're down just 3.8%, and it would have been more had we not had this really good investment year. So the good investment year has really reduced what this accounting change would have been, and so it's a great year to have a great investment result on our pension system. And so this is an interesting chart that the staff put together. If you look at what are the pieces of our net position, you can see we have just over $1 billion in 2014 of unrestricted, essentially unrestricted position across all of our university campuses and health system. Our capital assets is about $1.6 billion, that's the blue bar. Our restricted, non-expendable, those would be your endowments or things that we have to spend in accordance with how they were given to us, is almost $1 billion. And then about $477 million in restricted but expendable assets that we have. And that, again, just dips down, I believe, for this 1 year while we account for this net pension liability. So our operating results remain stable. If you see last year, the net operating income for the university system-wide, and this includes the healthcare system, was $58 million. This year it was $47 million. But if you note in there in the little note at the bottom, had we not had this late in the year $7.6 million restriction from Jeff City, we probably would have ended up fairly even. And because if you add $7 million back to the operating income for the education side, that would have been about $54 million. So we were really on track to have a very steady year from an operating income statement. The increase in net position from $216 million to $345 this year, again, is largely due to the investment returns we had.
On the previous slide,
Yes, sir.
the downturn between 13 and 14, is that entire, did you say that was entirely due to the change in the reporting requirement?
Yes. The reason it's coming down is it's just a restatement.
If it wasn't for that, what would it look like?
If it wasn't for that, you can add $250 million and the whole chart would move up to the right.
So the trend would move up about like it has this last year?
That's exactly correct.
That same range?
Yeah, it's still leveling off a little bit. Our operating results weren't I mean, they were very solid, but they weren't, they weren't any different than the last couple of years. Okay? Any other questions? So obviously a place like the University of Missouri system with all of its component parts, you need well-diversified revenue sources. You can see here on the chart that how big the healthcare system is, how big MU Health is on the operating side at 31% of revenues. So I think it is critical that paying attention to that piece of the portfolio is really important to the whole bottom line of the University of Missouri. State appropriation continues to be a small piece of the state university. That's a trend nationwide. And so I think what the challenge will be to the campuses is how do we grow that resident and non-resident tuition to offset and to do the main educational needs and services on our campuses, because it's clearly now where you see the students, both in-state and out-of-state students, are paying at or more than the state taxpayers in Missouri are paying to support their education, and this chart shows that. We have auxiliary operations, that's our bookstores and our daycare centers, all the auxiliaries we run. Housing is the biggest piece of that, obviously, the dormitories, resident life on the campuses. Grants and contracts are a piece, and then, so that's our operating revenues at $2.8 billion. Hal just went over this chart for you, but MU Health continues to have strong operating results, and I know as you looked at that chart that he brought, that's not always been the case. So it's important that the healthcare system not be pulling down the rest of the educational enterprise with having deficits in its operating results. And I think under the strong leadership you have there, at least my early observation, it's really coming and doing very well. And I think they're being very, very thoughtful and very strategic about where they're moving. The retirement plan has also helped our improves because of our investment returns. And if you can see here, the total pension liability actually has gone up from $3.4 billion to $3.5 billion. That's that first two numbers there. If I look out to the right, a year ago, your funded ratio, or your pension liability versus how many assets you have, gives you your net pension liability. Your ratio was about 85.3%. Well, the tremendous investment returns over the last year, it's 92.9, pushing 93% funded. And I will just tell you, as someone coming from the state of Colorado and who's seen these are numbers that governing boards of other public defined benefit pension plans would love to have. So I think there's been some incredible stewardship that predates me, and some incredible work done by the leadership of this university on the financial side, on the HR side, to bring you results where your pension plan is 92.9% funded. At least that's what it's projecting on June 30th this year, is really tremendous. And it's something, a system with this level of assets can certainly work through and get to having that fully funded. Yes, sir.
Just, I know it's a small amount right now, but is any revenue off of intellectual property, is that in auxiliary or is that in grants and contracts? Where do you?
I would have to defer to my controller, but I think it depends on how it comes in. Grants and contracts generally is not where we would put in intellectual property revenue, but I can get you an answer where we account for it, because I'm just understanding where we flow those in. I can get that for you.
Ryan?
Yes, Ryan?
It's an
Other, so it's in, so it's in the other category.
Thank you very much.
You bet. Thanks to my help in the studio audience. Back up. Are there other questions about the retirement plan? Obviously, Tom can talk with you more about the investing strategy, and they're going to walk through the returns of both the retirement and the endowment, but it's just, again, a very, very strong position for your retirement plan. And then, of course, our ratios, and in your packet are a number of ratios that are used by the rating agencies, used to compare us to our peers. But you can see that our primary reserve ratio was very steady. That top line, next at 2014, it declines to 0.53. Why? We're early adopters of the pension liability. Also, the viability ratio drops from 1.74 or 1.28 last year to 0.91 this year. And you can see our peers in Moody's AA1 are a bit higher, but they are not accounting for their net pension liability yet. So we'll see this smooth out next year when we bring this to you. But our return on net position stays strong at 8.7%, net operating revenue at 5.2%, well within historic averages for us. And again, I think it's an indication of the financial strength here at the University of Missouri. And one other piece we look at around our peers is the bond rating of the University of Missouri system. And in the left column, you can see that's a pretty select group of institutions that are public universities that are rated AA1. And that's where the University of Missouri has been for quite some time. Over in AA2 are a number of also equally prestigious public universities that don't have the bond rating that the University of Missouri does. In fact, the state just to the west was moved from AA1 to AA2 over the last rating period. So institutions do move between ratings based on state appropriation is a piece of that, whether the state is supporting their public institutions. whether the rating agencies think that there's viability or challenges coming, but there was a downgrade recently on this list that moved a peer institution from AA1 to AA2, and we just wanted to show that to you of who we are with. But obviously, in that AA1 leads to us issuing debt at very, very competitive rates, both taxable and non-taxable. Finally, we're well positioned for growth to help these campuses and these operations of the university grow. You can see up in AA1, the average would be 4.32. We're down in the 4 point. I have to get it because somehow the PowerPoint lost it. But our composite financial index is on page 1-8 for you, and we're at 3.43 now. And that's, again, against our peers because we're going to be early adopters. In fact, our information is the only other two public entities in the United States that are going to early adopt GASB 68 at this point is New York City's pension system and potentially the University of California system. So again, we'll be able to get this onto our books, deal with it, work through it, while others will be catching up to the University of Missouri. So I guess overall, in summary, I'd just say, from my perspective, the university, and I think from others' perspective, it's not just my perspective, the university is very strong financially. We are a leader in recognizing and accounting for our liability that is quite substantial and will be very difficult for some other schools in the country to absorb. We will continue to monitor our operating margins, both the campus's operating margins as well as the health system, and leveraging this low interest rate environment and investing for the future growth of this university is absolutely key moving ahead. And I think that's both on the student growth side, but it's also on the research side and growing the research enterprise for the institution. So I'm happy to take questions that I can hope to answer.
Brian, this is probably not fair, given how long you've been on the job, but I'm sure you'll defer to somebody else. That
I've got
may be
help
able
in
to
the
answer.
back, yes.
Just looking at the income statement.
Yes.
I noticed, and this is probably a Hank Foley question, but one, we had, as we expected, a substantial decline in our federal grants and contracts numbers. Looks like about $23 million decline from year to year.
Yeah.
And the question really for Hank or for you is, do you think we're going to stabilize at where we are now? Do we project a continuing decline? Or I know Hank is working very hard to try to make sure it doesn't go down further and actually increase, but what are we thinking right now?
Well, let me say one thing before Hank jumps in. That is not just our federal research grants and contracts. Also in there are student loan, student financial aid from the federal government. So there's a little more noise in there. There is a decline in our research awards year over year, and Hank and I were talking about that today. So that is not just research. There are other things going on that line. But Hank, did you want to talk about the research piece?
Mr. Chairman, our research expenditures did decline last year, just around 6%. Nationally, from what we're hearing, that's a relatively small decline compared to other schools. Penn State, for example, declined almost 5% this year, also a relatively small decline. Schools that are much more reliant on their medical centers and research from NIH have declined in decadal numbers, 10, 20, 30. We've even heard numbers on the order of 40%. Now, looking to the future, it's clear-cut that we've got to ramp up other revenue sources. We'll talk about some of those today and tomorrow, actually. But it's also the case that we're working hard to try to ramp up corporate funding, industrial funding. We'll be working harder on foundations because the outlook right now for federal funding is gloomy. It really is gloomy. So we have to look for other things. You'll see that we're predicting next year we'll try to go up by 2.5% to 3% in expenditures from where we are this year.
Thank you. One other question I had, do you have something
Just
else?
one more thing on that. That was also the tail end of the ARRA funding. If you remember, there was a lot of research put out one time as stimulus grants, and that's all starting to wind its way down. So that's also contributing to that decline, is the end of those stimulus research grants that were given to many of the campuses across the country to try, as we were coming out of the recession in 2008.
The other question I had on the income statement is on the expense side. Looks like we had a very substantial decline in our benefits expense, roughly well, $39-40 million. To what do we attribute that?
Well, part of what's going on here is the new way we're accounting for the pension is when I talked with my controller about that, because I did notice that as well. And this is welcome to the volatility of putting this net pension liability as it weaves its way into the income statements. But you definitely saw the benefits go down, but the position, the supplies and services, you can see what's going on there. Both of those lines have some volatility. Some of it has to do with this new accounting. Some of it has to do with also some costs for drug costs in the MU health system going up that they're moving. So you can't forget the health system contributing in this part. But the benefits going down is a new pension standard, and what Ryan, he can get up and explain it probably better than I can, but it's just about these new pension standards we're having to weave into our accounting statements.
So this is more of an accounting issue than a real substantive issue?
That's from my perspective and the way it was reported to me by my accountants, that's right. But I'll be more up to speed about it next year.
Other questions for Brian?
Brian, I note on the balance sheet, it looks like accounts receivable are up 37 million. Is there any reason for that?
Accounts receivable up 37 million. I don't know that we can get you an answer about why that would be. That would be both between the healthcare system and all the campuses, and we can certainly get you why that variance went up. But I don't have an answer for you standing here.
Thank you.
You bet. We'll get that for you.
Any further questions for Brian on this topic? Thank you, Brian. I know you'll be back before long.
I will be back. Thank you.
The next item on the agenda is the fiscal year 2014 investment performance review. Tom Richards, the Treasurer and Chief Investment Officer, along with Barry Dennis of Strategic Investment Solutions, will review the investment performance. And Tom, if you would just briefly further introduce Mr. Dennis to remind the board of the role that he and SIS play.
Absolutely. I'm just going to set the stage and introduce Barry Dennis, and then I'll come back near the end to wrap up. But again, in terms of setting the stage, what we're primarily focused on are the retirement plan and the endowment fund. And we just wanted to show you kind of a roll forward of activity for the year, just so you get a sense of kind of what goes in. The retirement plan, we started out about $2.9 billion. Employees and employer, us, the university, contributed $128 million to that. The benefit distribution payments out were $173 million. $459 million of investment income gets us at $3.3 billion toward the end of the year. And as Brian mentioned, obviously our funding ratio took a nice pop, driven largely by the investment returns that we're going to talk about. The endowment is a similar thing in the roll forward, except instead of our employer-employee contributions, we have donor contributions, which are probably nicer to get in at about $50 million. The benefit or distribution column on the endowment, the $53 million, that represents the spending distributions that are spun off of the endowment and paid out to the various spending accounts, sports scholarships, professorships, et cetera. And then investment income on endowment this year was approximately $182 million. So our endowment is up, getting close to $1.4 billion. It's my pleasure now to introduce Barry Dennis from Strategic Investment Solutions. Barry is our lead investment consultant. He actually co-founded SIS back in 1994, and he probably won't like me saying this, but he has nearly 40 years in the investment management industry. So I'm going to turn it over to Barry.
Thank you. Let's see. Okay, just a couple words about SIS. Thanks for the introduction. Thanks for your trust and confidence. What I want you to know about SIS is we don't have any conflicts of interest. The only money we take is from people like you, the owners of the assets. We don't accept money from money managers. We don't make commissions. Our recommendations don't change our bottom line. The other thing, you see 28 clients. Those 28 clients represent about $500 billion in assets. So I would say you're in maybe good company, but big company. And as Tom said, you're dealing with the founder, for better or for worse. Enough about us, let's talk about you. These are your asset allocations as of the end of the fiscal year. A very diversified portfolio, but still equity-centric, half of the assets in public equities. You will recall that when we went through the asset allocation studies in 2012, we raised the allocation to global equities by about 10 percentage points in each of the two pools. And if you think of the last 2 years, how equities have beat the pants off of bonds, those decisions have added tremendous value to your bottom line. I will say they don't get picked up in the evaluation process because when we changed our allocations, we changed our benchmarks. So you don't see it in the comparison to your benchmark, but believe me, it's there. You'll also notice we're slightly overweighted in equities. That's because we're using it as a parking place for the uncommitted private equity assets, and also because we are beginning the process of asset allocation right now to be presented to you next year. And we're reluctant to make rebalancing changes as we're in that process. Overweight in equities, underweight in fixed income. Pretty good positioning for a year when stocks beat bonds by a lot. Here's the performance by asset class. Global equities was a disappointment. We underperformed our benchmarks by about 2%. If that's half of the portfolio, it was a 1% drag on the total fund. That's not good. We were overweight by about 3%. That earned back about 15 to 20 basis points. So you could say the equities were about an 80 basis point drag, which when I show you the next slide, will explain the shortfall relative to our total fund benchmark. You'll also see some good performance in absolute return and in global fixed income, and that sort of washed the underperformance in the other asset classes. By the way, absolute return is a euphemism for hedge funds. I'm sure you've all read that CalPERS is exiting the hedge fund investment universe. Let me explain my understanding of the situation. CalPERS has $300 billion in their portfolio. They've put as much money to work in hedge funds as they can. That's $4 billion. $4 billion divided by $300 billion is 1.3%. So no matter how much work they did and how well they did in hedge funds, it wasn't enough to move the bottom line. So it was an issue of scale, not disappointment in the performance. In fact, their hedge fund performance has been pretty darn good, about 7% since inception. Here's the results on the total portfolio for the fiscal year. So you can see both the retirement and the endowment underperformed their respective benchmarks by about 90 basis points. Again, 80 of that is explained, as I just detailed, in global equity. But let's not say this was a bad year. That's one way to look at it, how you did against your own benchmark. Another way is how did you do against your peers? And of the 14 schools in the SEC, your endowment ranked 4th. If you exclude the other endowments that aren't $1 billion or more, your endowment ranked 1st. We compare you to a broad universe of public pension funds, over $1 billion in assets. For the fiscal year, you ranked in the 39th percentile, beating 61. Your endowment ranked in the 23rd percentile, beating 77% of the sample. So on a relative basis, the results were quite good. If we look at the longer term, so here we're looking at 3, 5, 7, and 10. Sometimes we beat the benchmark, sometimes we don't. It's a struggle. We started working with you, I say the last 2 years are the results that you could attach to us. We did pretty good in fiscal 2013. We didn't do very well against the benchmark, but I want you to focus on the longer term. And in the longer term, both portfolios beat a naive 60-40 global balanced fund. I know you've read a lot about keeping things simple. Our portfolio isn't that simple, but it's doing better than the simple portfolio. And again, these ranks against your peers, for 10 years, your retirement fund is in the 30th percentile, beating 70% of the sample. Again, that's public pension funds over $1 billion. And your endowment is in the 23rd percentile, so a top quartile performer. When we look at the longer term, the drag has not been the global equity portfolio. It's been real estate. The systems, both portfolios, invested a lot of money in real estate just before the global financial crisis hit. And that has hampered returns quite a bit. They are starting to come back. But over the 10 years, the real estate, only making up 5% of the portfolio, has been about a 50 basis point drag. This is a simple chart that shows you've got about 58% of your portfolio invested in equities. That's public equity and private equity, but it makes up 71% of the risk. So that's just sort of a be prepared statement that your portfolio is going to do well when equities do well, and it's not going to do so well when equities are in the tank. I realize I'm going pretty fast here, so stop me with questions. I spent spring and summer playing the bad cop, trying to beat up your active managers on reducing their fees. I didn't make any friends in that process. But we did have some success. We were able to lower your fees by about $1.7 million through begging, cajoling, and threatening. And we're still working on it. We're not done with the project yet. I hope to come back with some more fee savings for you. Here's what your fees look like. This is looking backwards on average for the fiscal year that ended in June. Let me say that due to the fee negotiations, and we did terminate one active manager that had roughly $250 billion and placed those monies into a passive portfolio, that next year's fees will be lower, maybe about 5 or 6 basis points lower on the total fund. You'll also see in the middle there that private equity, hedge funds, and real estate are very expensive asset classes to be investing in, given their smaller proportion in the fund. But they're there for a purpose. And I think the private equity is on a path to success. The hedge funds have been successful. And by the way, all these returns we've shown you are net of fee. So the fees are subtracted from the results. And the real estate is starting to come out of its swoon. Relative to others, again, that's something you should keep an eye on. I'd say you are a little bit more expensive than median. With this 5 or 6 basis point reduction, I think next year we'll see your fees fairly close to the average for your peers. I want to talk I skipped one, a bit about what we do when we're not doing asset allocation or performance measurement, and that's we're keeping a close eye, along with Tom's group, on your managers. We produce monthly performance reports, but we're constantly interfacing with your managers. And it's just not looking at numbers, it's looking at the qualitative. I like to say past performance is not indicative of the future, and everybody says that, but I mean it. If you're trying to predict if Kevin Durant is going to make that free throw or Tiger Woods is going to make that next putt, past performance is a good indicator. In our business, it's not. So we have constant discussions with your managers to understand how they react in good times, how they react in bad times, how they respond to good decisions and bad decisions, to get a feeling for how they're going to do in the future. And each case is different. Each case is different. We have to treat each manager separately, and together with your staff, we spend a lot of time just doing just that. Currently, we have 3 of your active managers on review status. Odds are that one of them is pretty close to termination. We will move those assets into some cheaper form of passive type management to lower your fees further. And we did terminate one active manager in 2014 that had chronically underperformed and wasn't doing what we thought they should be doing. With that, I'll turn it back to Tom if there's no questions to talk about the general pool.
Tell us about how much of the funds are you putting in passive type of activities rather than active, and what's your philosophy on how much you should use in passive versus active managers?
Sure. If I could just address your question to the equities, the stocks?
Yeah, sure.
Okay. Currently, about 1/3 of our stocks are passive and about 2/3 are active. Now, if we exclude the emerging markets from that total, and I don't think anybody would tell you you should be passive in emerging markets because there's some countries you just can't index. Yeah. Then that ratio goes up to about 47, 48%. Passive, 52, 53 active. And our philosophy is you should be part of both. I've been asked this question probably 200 times in my career. Should we be active or passive? And my response is yes.
And tell us what's your philosophy behind that?
Well, I think, first of all, there are, there's these studies that say active managers don't win, but they're sort of naive because they're comparing all the managers to one benchmark, typically the S&P 500. If you break it down and compare large value managers against a large value index, small growth managers against a small growth index, you get a much better outcome. And that outcome says the median manager is pretty much right on top of the index. So it becomes a coin flip on whether you win or lose with active management. And we think the experience of our people in following these managers, interviewing these managers, will shave that coin in our direction. On a much broader perspective, if everybody invested 100% of their assets passively, the world would not function because there'd be nobody to set the prices of the stocks. So I think it's very important from an economic perspective that the world have some passive management and some active management. What the exact ratio is depends on your specific circumstance.
You know, markets go up and they go down, right?
Yes, sir.
So in an up market, you have, I imagine, one philosophy on passive managers, and when in a down market, do you have a different philosophy on what percent should be passive?
Well, I wish we could, because that would mean we'd be able to predict when markets are going to go up or down, and frankly, we can't.
But they've been up for 5
But I
years.
think the evidence says that active does better than passive in down markets and trails a bit in up markets. That's a function of the managers holding cash, though. So a manager will be 95% in stocks and 5% in cash, and it's that 5% cash holding more than their stock selection that's saving their bacon in the down market.
Barry, let me ask you a question, and we've had discussions, and everybody knows my views about passive versus active, so I'm not going to re-argue the position.
Good.
Could you restate those?
You know,
I'm not sure.
I think I've been a broken record for a long time, and I'm only on the board for one more meeting, so they don't have to listen to me after that. But for the future, you said you gave our rankings on where we compare to other public, I think, universities, endowments around the country, and we're either 30% or 40%, 40th percentile, something like that. So basically pretty good, right?
Yeah.
Are most public universities, endowments, and retirement systems done through active management? I mean, are a large number of them purely passive?
So I compared you to two different universes. The retirement was compared to all public pension funds with more than $1 billion in assets. I would say that that group tends to be more passive than the endowment group. And the ratio of active to passive is probably right around 50. The endowments tend to have less in equities and more in things like hedge funds, private equity, real estate. So what they have in equities tends to be all active.
So, so comparing us to the endowments, where more active management, what did you say, what percentile are we?
Your 1 year was like, your 10-year was in the 23rd percentile, and your 1 year was 22nd percentile. So very consistent.
So we're in the high quarter, at
Yeah.
least, on endowments, and most of those are actively managed. And we missed our benchmark in our endowment fund over 10 years by a full percent in our global equity category.
Yeah.
So that means that most other public universities with endowments who are actively managed are missing their benchmark by more than 1% over a 10-year period.
Oh, no, it means their benchmarks are lower than our benchmark was.
Well, our benchmark is the overall market, I assume, for global equity.
No, your
It's different
benchmark
for each category.
is your weights, yeah.
Right.
So when you add up the total, it's the sum of your individual asset class benchmarks.
I guess the point I'm just trying to make is if we're doing better than most, and most are active managed, and we're primarily active managed still, even though we're moving in the other direction, it just makes sense to me. Why wouldn't we be passive, and we would be, way up the scale if the last 10 years is any indication?
Well,
For global equity, I'm not talking about bonds, I'm not talking about private equity, I'm just talking about for the global equity category.
I think the reason we're ahead of the other endowments is that they have more in esoteric things. So the endowments had a lot in hedge funds, private equity, and real estate when the markets crashed in 2008 and 2009. They put themselves into a liquidity crunch where they weren't able to rebalance back to their equity targets, whereas we didn't experience that problem. We lost money like everybody else, but we had the liquidity to reinvest in the equity markets, and you did. That's where you shot ahead of that group. I would say that our shortfall to our benchmark over 10 years is most explained by real estate, not equity performance.
But, yeah, we're down 4%, I think, in real estate, but 1% in our global equity. And if we had been on the benchmark for those 10 years, we would be at 0% down. We'd be right on the benchmark.
That's true.
And that's, hindsight's 20/20, I realize. And who
Hindsight's
knows what the
20/20.
next 10 years will hold, and I understand all that. But I appreciate the conversations we've had on this, and it sounds like the direction that we discussed yesterday, is to the extent we have active managers in global equity underperforming their benchmarks, we're going to be shifting over that portfolio to passive in the future, right?
Yes, when we're identifying managers to cull, those monies are moving to more passive vehicles. Yes, sir.
Thank you.
You're welcome.
I have a question.
Yes.
Here. In following up, and this is part of the chairman's conversation too, and Curator Bradley's, and I would defer to the chairwoman on how we going forward measure our performance. But to me, peer-to-peer is very important, but in my experience, it's very misleading. Even though our percentile is good among public funds, many public funds are abysmally run. If you go around the country and watch political ads, you'll see that they hire someone at so much per month who then decides that that's a good fund to buy. And so it's a little misleading to have a high percentile when such, I hate to say it, high percentile of public funds are an embarrassment. It seems to me it might be possible, and again, I'd go through the chairwoman, to develop some sort of peer-to-peer among the excellent institutions which have a proven track record and identifying those, and I think the public records are there, We could even do it among public funds in Missouri, for example. And I would be interested in exploring that as a way to have what I think is a more valid peer-to-peer measurement. Do you think, would that be possible without?
I think we can work on that, yes. And I agree with you that comparisons to your own well-constructed benchmarks are the most important comparison you make.
Well,
And it's not because the peers may be not as smart as you. I think it's because the peers may have different investment objectives than you do.
Actually, I wasn't even quite saying that. I think that's a very important part of it, but I think it's important to identify excellent funds with good 5- and 10-year returns and not be afraid to learn from them, is what I'm really saying, too.
We can work on that, yes, sir.
Any other questions of Mr. Dennis at this time?
Thank you.
Could I, Curator Steelman, simply say that the chairwoman or any other chair of a committee simply calls the meeting to order and runs the agenda and has no greater or weaker voice in the say of anything that goes on than any other member of the board. So deference is not due. Thank you very much.
Okay, just to wrap up with a couple of slides, just to cover our general pool for starters. At the end of the fiscal year, we were at about $1.7 billion, which is generally consistent with where we've been the past several years. That's, the pool is invested in 3 different buckets. The first is the internally managed fixed income bucket, about $593 million. That is invested primarily in U.S. government securities with a duration of 2 years or less. That's our liquidity pool that is helpful in the management of our debt. So it's not optimal from an investment standpoint, but from a liquidity standpoint and what our investors and rating agencies expect of us, it's important for that. Externally managed fixed income, $747 million, has performed very well. I would remind the board that that's a bucket that previously had been managed in-house by the Treasurer's Office staff, and we outsourced that investment to an external party, and we probably picked up 200 to 300 basis points in return after having done that. The final bucket of about $400 million is in risk parity accounts, which I would be happy to talk in more detail at another time. The overall return for the general pool this past year was 6.23% compared to a loss of 0.9% in the prior year. Two different angles. The 6.2% we're really proud of, and considering kind of liquidity constraints that are put on the investment of this pool, that's a very strong return. It was driven in large part by risk parity this past fiscal year, which had returns of about 15.7%. The loss that we had last year, the 0.9%, if you will recall back in May when Ben Bernanke was speaking to the media and he said the word taper and it set off basically a market correction, interest rates shot up by about 100 basis points. That happened right before the end of the fiscal year. And when you have a portfolio that's primarily fixed income, that's kind of what went on. So, but we've kind of managed through that.
What's that? Can you explain that risk parity portfolio? What is that, Tom?
In a nutshell, it's just a very extraordinarily balanced, diversified portfolio that is designed to have components that will perform reasonably well regardless of the economic sort of scenario. And we'll talk a lot more about that and those concepts again as we get into asset allocation. But just think a very well-diversified, balanced portfolio, which incidentally is implemented on a passive basis. So.
Tom and I have had many discussions about risk parity.
Yeah. It's, we had a good year. The fixed income pool is just something in policy we report on. This actually is about to go away because of some changes in state legislation, but it's an endowment pool, and the endowments go back a long time, and they had requirements of only being invested in fixed income. We're going to be able to move the vast majority of these accounts into our regular endowment again, given the statutory changes. And then the other post-employment benefits trust fund, $68 million roughly. This has to do with money set aside for the employee, the retiree health care benefit. it's really invested pretty short because we want to keep maintain our flexibility as we continue to look at that going forward. But I just wanted to report on that. Whoops. So I have started to give an update at this meeting every year because as we talked about our financial results and our retirement plan, the retirement plan year end is September 30th as opposed to our fiscal year end at June 30th. So we just wanted to give our best preview of what we think the return will be for the retirement plan. We kind of just did the math here and showed you the actual quarters as well as the quarter that drops off from the prior year. The 2 months through August 31st, the return had been about 0.2%. So we had said that as long as the return in September was above a loss of 2.4%, we'd meet our return assumption. Well, based on very, very preliminary results, because it is actually just the first of the month or the second, we think our returns in September were down by about 1.6%. Which we think then would put the overall plan year return somewhere around 8.5%. So clearly above our targeted return of 7 3/4, but those returns are starting to come down. Just for comparison, again, just for the month of September, if you look at the entire global stock market index in September, it was down 3% in the month. And again, you're hearing news stories every day, so you're already aware of that. But timing is everything, and September 30th is our year end. And that's all we had for the investment update.
Any other questions for Tom on this item? If not, we'll move on, Tom, please, to the update on debt issuance for approved capital projects for the system.
Okay. Let's see. Okay. It seems like we just gave an update like this last fall, preparing for a debt issuance, because we did, and of course we issued debt last fall, and we're coming back to do that again. Just a very quick overview again. I just want to point out in terms of the team for debt issuance, Prager & Company is our independent financial advisor that helps us with all the transactions and dealing with the investment banks and keeping them honest. Thompson Coburn has been our bond counsel for a long period of time, and Gilmore & Bell serves as our disclosure counsel. We have an extraordinarily fantastic team that we work with to put together our debt offerings. And that team and the strength of that team has given us great credibility within the markets in terms of our offering statements, disclosures, et cetera. On the other side of the house, from the investment banking standpoint, we had said last year we went through a competitive process to select a team of 3 investment banks, probably for a period of roughly 3 to 5 years. The reason, again, that we do this is that we really would like to form closer and tighter relationships with a smaller group of firms. And it's a good way to manage these relationships. So Bank of America, Merrill Lynch, Morgan Stanley, and Barclays are the 3 firms that are in the pool at this current time. This slide is just a reminder of capital projects that have already been approved by the board, including the debt financing has been approved by the board, but we've not yet issued debt. The projects total about $256 million. One of the things I wanted to mention, we're always concerned with our credit ratings, as we should be. When we spoke with the rating agencies last fall, before our debt issuance last fall, we made them aware of the capital projects. So when we talk about issuing debt and going back to the rating agencies, they're already aware of this, and this was already taken into account when they did our review last year. So I just wanted to say that up front. Of the $256 million...
So Tom, let me just ask a question right now, since you're on that point. So they're aware of this, so that when we proceed with the issuing this debt, there's not going to be an issue on our credit rating?
We would not expect any issues. And on top of that, we're coming off a very strong financial year with growth in the balance sheet. And one of the things, again, that Brian mentioned in terms of early adopting this pension statement, that says a lot about sort of the integrity of our financial reporting and the tone at the top and governance, that we're being very transparent and open with the markets.
I think that was a great idea. I don't know whose idea it was, maybe yours or Brian's.
Collectively.
It was a great idea.
Okay, so the plan, well, and let me just mention it, okay, so the 256 million, we're still taking a hard look at this, and it may depend on where interest rates actually are when we get closer to issuance. We probably only need right now about 150 to 200 million dollars of that 256. There are some projects that have been approved, in particular MU Residential Life, where they're phased projects, and there just are phases that aren't going to occur for a couple of years. And so we're going to evaluate how much debt we want to take out now versus just deferring and issuing later. And I'll talk about the rate environment in a second. So most likely, we'll probably have 2 more debt issuances from this round of projects that you've approved. We said some mixed of fixed and variable. I'm nearly 95% confident this fall's issue will be a fixed rate issue, and I'll talk about that. And again, as a reminder, the university has its own commercial paper program, so we have ready liquidity in the market if we need interim financing for any of our capital projects, but we also have liquidity just on our balance sheet. So it gives us great flexibility. Our plan for the issuance this fall would have Bank of America and Merrill Lynch serve as the lead underwriter, and we're working with them already. In fact, the entire team has been engaged for the past 6 weeks or so getting our documents ready. The big thing that we're waiting for right now is the completion of the KPMG external audit. We've already sent to the rating agencies our financial results, marked unaudited, but basically they're in final form, as well as the enrollment data, which again was very positive from a rating agency perspective. So we've given the rating agencies all the information they need to do their analysis, and we've got meetings scheduled with Brian and myself within the next week or two to talk with each of them about the debt issuance. In terms of where rates are, it's looking like we're going to want to move forward as quickly as we can. Again, last year when I spoke about this, we were talking about, and we ultimately did, a 30-year taxable bullet of $150 million. We were able to lock in a rate on that of 4.9%. And we were very happy with that rate, and that was and remains a very good rate. Today I can tell you that if we were to issue debt today, we could issue a 40-year taxable bullet for about 4 to 4.1%. Rates, again, have come down 80, 90 basis points. It's not unthinkable that it maybe over the next 3 to 4 weeks, which we might be targeting, rates could come down further. There's a lot of turmoil going on in the world right now, Asia, Hong Kong. So to the extent that there's any flight to safety, that could always bring down the Treasury rates, which would also be beneficial for us. So our plan going forward is, as soon as the audit's completed and the documents are completed, the rating agency reviews are complete, would be to go to the market as quickly as we can. And similar to what we did last year, we would require and ask for a special call meeting of the board to approve the bond documents that are required. That's the update, if there are any questions.
No questions of Tom on this point. We'll move on to the biannual review of delegated authority, hiring, and termination of external investment managers.
Well, that's a okay. This is just a quick update. In June of 2012, the Board of Curators approved a new comprehensive investment policy for the university that included a delegation of authority for the hiring and termination of investment managers. As part of that policy, management is required to submit a report to the board at least once every 2 years concerning such delegation, its continued advisability in light of all relevant factors. I wanted to point out and stress again that the board remains in control, responsible for the investment policy as well as setting the asset allocation targets that Barry Dennis had talked about previously. So the board sets the tone, the agenda, the targets. This has to do with how staff executes the board's policy. Since the time that the delegated authority was approved by the board, we have hired or terminated approximately 65 separate investment management accounts for the endowment pool, general pool, and retirement plan. We provided a detailed listing in your board materials for that. Prior to the change in the investment policy, each of these would have had to come before the board as an action item requiring approval by the Finance Committee and the full Board of Curators. As part of our process, a detailed due diligence package is prepared for each manager hire and termination with documented approval of the Vice President for Finance, the Treasurer, and our investment consultant. Approval documentation in the package also includes sign-off on all legal matters from the Office of General Counsel, and it also documents consultation with the President. And we've included a sample form, approval form, in your board materials as well. Once all the approvals have been obtained and documented, a complete package is forwarded to the Chair of the Board of Curators as well as the Chair of the Finance Committee. A summary of all manager hires and terminations is provided to the entire board through the quarterly investment and debt update report. From our perspective, this process has been working smoothly and efficiently as it was intended. I'd be happy to answer any questions.
Questions for Tom on this item? If not, thank you very much, Tom. Brian, you ready to proceed with the project design for the optometry and nursing building at the University of Missouri St. Louis?
We can get that. Do you have a PowerPoint for me? Or not? Not finding a PowerPoint? Okay. Maybe we didn't include it. So behind tab 5 or information 5-1, you'll see a summary sheet of the project design for phase 1 of the optometry clinic at UMSL. And this is a multi-phase project. And I think behind the sheet you can see what I thought we were going to have a PowerPoint to show you, but evidently not. So I'll just talk with you about this just briefly. And sorry?
They were given all of that information in the board book.
Okay.
So it's in their
So that's why
materials.
we're not rolling it up here? Okay,
Right.
thank you. And obviously, Chancellor George can chime in here if he likes. But we can walk through this kind of quickly if you have it in your books. So the design is across Natural Bridge Road. You can see that the location is to the southeast of the kind of the main campus as the campus moves towards across Natural Bridge Road. It's there in the green on I'm looking at 5-2. And then if you look at page 5-3, 5-4, I'm sorry, that this new optometry nursing building is built to be phased and expanded, as I understand that the UMSL campus wants to pull optometry together with nursing eventually, and makes sense to put a healthcare center together for those unique programs on that campus. So you can see the future phase has been programmed in by the architects, which I think makes perfect sense, and with adequate parking, because all roads on a college campus lead to parking. If you flip to the page 5-5, you can see inside where they've got the optometry, the contact lens, the patient health, those types of things. Looks like a very open design and very much in the spirit of the modern architecture on that campus. And the tenant lease space, Chancellor George could talk about that a little bit, but as I look at this building, it's certainly got some opportunities for you to do some public-private partnerships with the space in the building. So I think the role is just to revise this, and you move towards slide 5-8. You can see what the exteriors of this building would look like under this design. Again, a very modernistic structure, and really in a real prominent area around the UMSL campus, being there right on the road, and heading towards the light rail station, if I'm correct, out to the east there. So I'm happy to take any questions about this process or this building and the project design for the board.
Brian, this is just an update, remember, we take no action today on anything.
Okay, so I'm just,
Up to this point.
Slide 5-6.
Yes, sir.
Shows the second level, the tenant space, and then there is, it looks like other space, but it's not defined what it is.
I think that's open to below, you mean in the middle there?
There's open to below, and then there's additional area between open below and tenant lease space.
Yeah, I think that, I'd have to ask Chancellor George, do you have that up in front of you?
Yeah, I'm looking
I
at
think
it
those
right
are open
now.
to below on both, but go
Yeah, I
ahead.
think on both as well. The tenant lease space is about 13,000 square feet, and that's, we went through this in great detail about a year ago when we had the meeting at St. Louis. And, that's available for, maybe urgent care. We are talking to UMKC possibly about a branch of the dental school. And so that particular area. The rest of the building, this essentially is, I should mention, clinical instruction. So all the other space we see is devoted to clinical instruction. The next phase of this will be research and other kinds of instruction, and clinical instruction then includes also service to the community.
But we can get you an answer about that white space if that's it, because I can see how it looks like. Is it floor space or is it open to below? It looks like floor space from your question there. We'll get you the answer for that.
Let me ask this question, Tom. Is any of this space designed for, there's an ongoing battle between ophthalmologists and optometrists, according to my ophthalmologist?
I will.
And is any of this space being designed for future surgical centers,
Okay.
which now the optometrists are not allowed to do?
Let me, I don't know if this is working or not, but let me be very explicit that we are not proposing to do any surgery by optometrists. Now, you can, if you're in Kentucky and Oklahoma, evidently you can do LASIK surgery. I mean, that's permitted. We have no intention of doing that. What we are patterning this after, though, is we went to the University of Houston, which is the Cadillac of optometry colleges, and they lease space to ophthalmologists who do surgery on their premises, but it's not the optometrist doing the surgery. We haven't ruled that out, but at this point in time, certainly no surgery by us, and at this point in time, we don't have anything specifically assigned in terms of doing surgery there. The one-stop shop is really nice, though. I mean, you go to an optometrist and then can move on to an ophthalmologist right in the same place.
If you can get the two groups to work together, I commend you. That's not been done around here very often.
No, this is a challenge. I know.
It is certainly a state-by-state fight because of the licensing
But
provisions.
we have no
Absolutely.
intention of doing surgery by optometrists in that space.
Any other questions on this project design? If not, we will move along. Brian, to the investment consultant annual approval.
Okay, on the next tab, under curator rules, the investment consultant contract must be reviewed annually by the board. And you heard from Mr. Dennis, the principal of SIS, earlier. As shown on our information sheet here, our fee will remain flat again next year at $450,000. And we believe, while the services, while not cheap, are very important to us as we manage both the retirement portfolio and the endowment portfolio. And we've had very good results, and we've given you a number of information sheets behind here about SIS and their work since their firm was founded. So we are recommending that the board approve maintaining our relationship with SIS for another year.
Is there any discussion or other questions before I ask for a motion? If not, Mr. Cups moves. Is there a second from the Finance Committee?
Second.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Good?
Aye.
Curator Phillips?
Yes.
And Curator Stillman?
Yes.
Okay. All committee votes in favor.
Thank you, Cindy. Mr. Chairman, the committee recommends to the full board to approve the investment consulting firm's SIS be approved for 1 year.
Is there a second?
Second.
Cindy?
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Downing?
Yes.
Curator Good?
Aye.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Curator Stillman?
Yes.
Okay, all votes in favor.
Thank you.
Thank you. We're going to move to the state capital appropriations request, please.
Yes, so we have two smaller capital appropriations requests to put forth that we need approval by the board at this meeting because of the deadlines to submit them to the state coordinating board. And the first one is a STEM laboratory renovation at the St. Louis campus. This would be a total of $1.5 million project, so this would be under the 50/50 match program. The campus has brought $750,000 in donations, and obviously with the STEM focus in the state of Missouri, this is a project we think you should support, and we'd like your approval to submit it to the board, the state board, for inclusion in the formal request to the state for the upcoming legislative session.
Second.
Motion, is there a second?
Second.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Good?
Aye.
Curator Phillips?
Yes.
Curator Steelman?
Aye.
Okay. All committee votes in favor?
Thank you, Mr. Chairman. The Finance Committee recommends to the full board that the president be authorized to submit to the appropriate state offices the application and request for a 50% matching amount in the amount of $750,000 for the purposes already discussed.
Is there a second?
Second.
Cindy?
Curator Bradley?
Yes.
Curator Good, or Covington?
Yes.
Curator Cups?
Yes.
Curator Downing?
Yes.
Curator Good?
Aye.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Curator Steelman? Yes. Okay, all votes in favor.
Thank you. And the last item on the Finance Committee agenda today is a state capital appropriation, and you heard from Dr. Williamson earlier about a fourth floor for the expansion of the Missouri Orthopedic Institute. They do have a $3 million gift, and they would like to submit this to the state also to try and attract $3 million of state funding to go with that. There's information in the packet on page 3-1. But essentially, this would put that fourth floor on the expansion of that building that was in Hal's presentation earlier. And we're hopeful that this one also would be looked on favorably by the Missouri legislature for inclusion in next year's budget. And the system is recommending its approval.
Is there a motion?
Second.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Good?
Aye.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
Okay, all committee votes in favor?
Thank you, Mr. Chairman. The Finance Committee recommends to the full board the recommendations that have been stated by the Vice President.
Second? Is there? Cindy?
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Downing?
Yes.
Curator Good?
Aye.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
Okay, all votes in favor.
Thank you. Is there a motion to adjourn the Finance Committee?
So moved.
Second.
Excuse.
If I can just follow up on one last question on the accounts receivable while I have you, if that's appropriate. We did have an increase in accounts receivable. A lot of our federal appropriations were delayed by Congress and that type of thing, and that raised it. Also, we were holding an $11 million receivable for that biomass plant that actually came through after the fiscal year. So that's the big reason for the accounts receivable increase, and I just wanted to get that answer and close that loop. So, thank you.
Did you have a vote to adjourn?
Vote on the motion to adjourn the Finance Committee?
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Good?
Aye.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
Okay, all votes in favor.
Thank you,
Thank
Chair
you.
Covington. Very efficient. Thank you, Brian. Baptism by fire a little bit, but thank you. Next item on the agenda is the Governance Resources and Planning Committee meeting. Chair Good.
Thank you, Mr. Chairman. We have 3 action items. The first is the campus master plan at UMKC, and Chancellor Martin, I believe, is going to make that presentation.
Oh, thank you, Curator Good. Actually, I'm up here just to tee this up. It's actually going to be presented by Bob Simmons, if I can not destroy the control here. He's our Associate Vice Chancellor for Administration, but Just to put this in perspective, facilities on any campus are critical to your ability to execute on your strategy. And if you look back over the past 20 years on this campus, you'd find about 18 projects that have been, this is new construction related to our master plans that you've approved. In those 18 projects, you'd find about 2.4 million square feet of space that's been added at a cost of about $350 million. In the last 5 years, 50% of that has been done. Now, I'd have to tell you, none of that could have been done without the support we've received from the system, so I'm here to say thank you for all of your support for this campus. And of course, we've had some special donors like Mr. Henry Block. So we've been fortunate to be in a community that's been very generous. Now, the other thing I would point out before Bob Simmons comes up here is that in those 20 years, all of those projects have been managed by Bob Simmons, either while he was at the University of Missouri system or since he's been on this campus. I can also tell you that every project has been delivered on time, within budget, and meeting the requirements that we set out. So with that, I'm going to give you Mr. Bob Simmons, our Associate Vice Chancellor for Administration.
Thank you, Chancellor. Thank you, Board. It's a pleasure to be able to present the plan updating our campus master plan. In 2002, UMKC presented a new campus master plan to the Board, and that master plan set out a bold path which firmly integrated the then new campus strategic plan and resulted from a robust campus and community engagement process. This master plan was updated in 2005 and 2008 with minor revisions, but each update that we've done has remained true to the underlying principles of that 2002 plan. The UMKC master plan builds upon our vision statement, emphasizing our role as a diverse and engaged urban-serving research institution. The master plan also builds upon our four-part mission statement in the areas of life and health sciences, visual and performing arts, urban workforce and education issues, and the creation of a vibrant learning campus life experience. Finally, this 2014 master plan supports the campus strategy statement as developed through the UM System Strategic Initiatives process. This statement focuses on specific enrollment growth goals gained by capitalizing on our unique market position and increased student graduation rates through efforts that support student success. As more fully illustrated in the matrix, which was included in your board materials and the master plan brochure, and there's also copies available of that out for the audience, our physical campus master plan has key and intentional ties to the 7 areas of focus that were identified through the UM System Strategic Initiative process. I want to speak initially to the master plan perspective of the Volker campus, and then we'll turn to the Hospital Hill campus master plan. As a campus, as the Chancellor has noticed, we've been very busy. So as we start to talk about the Volker campus master plan, we want to talk about some of the results from the 2008 master plan. In the area of student success, these results reflect a creative and careful blending of capital funds from multiple sources. Revenue bonds paid in more traditional means, like housing fees and dedicated student fees, funded construction of the Student Union and the Herman and Dorothy Johnson Residence Hall. Revenue bonds were also creatively used in dedicating revenue from future enrollment growth to construct the Atterbury Student Success Center, which you see in the upper left-hand corner there. This center now serves as our one-stop shop for programs which focus on student recruitment and retention. Similarly, academic and support facilities have benefited from this careful blending of capital funds from multiple sources. Again, dedicated revenue from future enrollment growth was used for the revenue bonds to construct the Miller-Nichols Learning Center. As the Chancellor noted, UMKC has also benefited from the benefactor of Mr. Henry Block, who fully funded the Henry W. Block Executive Hall project. Those two educational facilities combine to provide the additional classroom space needed to attain our strategic enrollment goals for undergraduate programs in the form of the Miller-Nichols Learning Center and for the Block School of Management through the Block Executive Hall. Moving from our accomplishments since 2008 to the future plan, the Volker Campus Master Plan reflects a number of projects that are currently in planning and design. These projects are consistent with our strategic plan and with the capital plans as submitted previously to the board. I would highlight that I will be highlighting a few projects in particular, but I would note that in general, the projects reflect a focus on renovations of our core academic buildings that have a high deferred maintenance need and the also use of limited strategic additions that address teaching lab needs on the campus. This is in contrast to the general educational needs, classroom needs, that were addressed by the Miller-Nichols Learning Center and the Block Executive Hall. These teaching lab needs are particularly focused in the STEM areas. So the first project to highlight is the renovation and strategic addition to the Biological Sciences and Spencer Chemistry buildings. These 1960s era buildings, like so many science buildings across the country, have a very high level of deferred maintenance in key building systems such as HVAC, lab exhaust, and electrical systems. The facilities also require significant programmatic adaptation in their teaching labs for new technology and lab instructional design. These new technologies better prepare undergraduate students for both the workforce in the life and health sciences and for graduate study and further study in the medical, dental, and other health-related fields. These facilities in their current state represent a significant recruitment and capacity bottleneck for UMKC's enrollment growth in the STEM areas. The master plan also calls for construction of the Free Enterprise Center at the 215 Volker site on the northwest corner of the campus. This $14.8 million project, which awaits funding through the State Higher Education Capital or 50-50 match program, as some call it. This building will serve the 3,000 plus students in the Block School of Management and the School of Computing and Engineering as they pursue the entrepreneurial aspects of their program. Is there a question?
I didn't
Chris?
want to stop you mid-sentence, but I want to go back to where you were before. You mentioned those buildings that are hard to maintain and so forth. I think most of those are from the 70s.
60s and 70s, yes.
Yeah. But you didn't say what you were going to do with them. Are they being torn down and replaced?
No, the ones that we're talking about
Yeah.
that in our requests are going to be renovated. Then there would be small additions. One of the problems with buildings that have been around for 40 or 50 years when you talk about renovations is that a lot of times you don't have any swing space to begin the renovation. So unless you're going to renovate them, one lab at a time, which is very time and cost intensive, we look at doing a small strategic addition that creates some swing space so that we can then roll into the renovations. So our capital plan, as was submitted, is essentially a renovation project of that facility.
But they're also hard to renovate because a lot of those problems are just built into the design of the building, like the flat roofs and, some of the HVAC systems that are hard to replace and so forth. Are you going to deal with those in a way that the problem's going to go away or just be put off for come back in another 20 or 30 years?
The intent as we look at these full building renovations is that we deal with it all at one time. Curator Good, a lot of the times when you get the situations you've talked about is when you do a piecemeal renovation. Let's say you're dealing with the fume hoods, but you couldn't deal with the air handlers or the roof, and you end up with a lot of Band-Aids kind of solutions. So that as we've submitted this, it's really dealing with the entire building to address all of those systems holistically. And the buildings actually, as a structural system, have very good bones. They actually have good pathways for a fume hood exhaust. It's a concrete building. It's rock solid. So once we are able to do this full building renovation, we feel like we will have addressed all those things that you
They
discussed.
don't have those inherent roofing problems that keep reoccurring?
Well, we actually put a new roof on this building about 5 years ago, so,
And it's good for what?
20 years. And it has solved the problems that that
Okay.
building had. So,
Thank you.
okay. With the Free Enterprise Center, we've talked about how it would serve the 3,000 students within the Block School of Management and the School of Computing and Engineering. The building will also be serve as a product development hub that will be available to entrepreneurs, local industry, and both high school and college students as they pursue their entrepreneurial ventures. And as I mentioned, this is a project that we're hoping to see a release of funds that made it through the legislature as a 50-50 match project. The next project I want to highlight is the Oak Street West development. The university continues to pursue this exciting project that would be on the west edge of campus. It's a public-private partnership that includes the first Whole Foods market in Kansas City, Missouri, and 150 market-rate apartments. But the project would also provide a greatly improved location and amenities for our student health and wellness, counseling center, and disability services programs serving our students. This construction would start once all the agreements are finalized, likely early next year, with an opening sometime in 2016. One final item of note for the Volker campus is the formal designation of the 5200 block of Rock Hill Road, which is shown in this area of the plan, as the first development zone for fraternity and sorority housing. The role of small group housing like this continues to expand at UMKC, and it's an important aspect of our enhanced student living and learning environments, as well as our recruitment and retention plans. So moving now from the Volker campus, I'd
Let me
like to...
ask you a question on the fraternity development. Are those buildings going to be owned by individual fraternities, or are they going to be owned by the campus?
As we look at that long-term development, I would say that we are looking at all options. And within the University of Missouri system, we have examples of some that are owned by the university that are long-term ground leases or facility leases. That has been the model here at UMKC for the Beta House, which is 2 of the houses that exist on that property now. But then there's certainly other examples on the Missouri S&T campus where there's ground leases there where the actual organizations have done a development under a long-term ground lease. So we haven't locked ourselves into one approach or the other at this time, and we think it's likely over the long period of time that we might pursue both. But we would not be selling any of the land. Our idea is we would maintain the ownership of the land, and that it would either be a facility that's the house that's there now is a long-term lease to the chapter, or that if there's a new build, that it's under them doing that building and we're doing a long-term ground lease to them. So those are the options that we've talked about at this point in time. But everything that we're doing to date is in the realm of a long-term lease of an existing facility to a chapter.
And has that worked well here?
It has. It has. It's limited. It tends to limit the size of your organizations, but right now those organizations are right-sized for UMKC. At some point they may not be because we're working in existing houses, and probably the most, actually the house that we will be renovating for the Chi Omegas will have 28 student beds in that area. And for the 2 Beta houses, between the 2, they have about 28 beds there as well. So that is kind of a limitation for the size. It serves us right now, but new construction for larger chapters would be a possibility in the future.
And that's worked out well financially?
Yes, it has.
Is there any, can you talk about the Whole Foods just a second? Briefly tell the curators, how does that public-private partnership work, and how much are we subsidizing Whole Foods or not? Or was it a competitive situation with other grocers?
So the Whole Foods agreement came into the university as a possibility about 4 years ago. And we had done an RFP for development opportunities in that Oak Street West development a number of years before. Initially, we had not had any response to that development, and so this came in as a late proposal. The university would be doing a long-term ground lease, a 50-year ground lease on that property, and the developer is doing all of the development. So we're realizing income off of the ground lease. They're doing all of the capital costs and development. And then the space that we would have within the development for our student health, that would be a traditional property lease. So we would be leasing that as a tenant, but there's an overall ground lease that underlies that.
So we're leasing to Whole Foods at market rates?
And I say, actually, so the Whole Food, we are leasing to a developer, Van Trust Entities, that's actually doing the overall development. They will have this, then the lease to Whole Foods, but everybody kind of calls it the Whole Foods development because they know who they are. And it is a market rate deal.
Market rate, okay.
Okay, thank you. So as most of you saw this morning, and you would have seen more of it if it wasn't raining as hard as it was, our major accomplishment from the 2008 Hospital Hill Campus Master Plan was the opening of the new Hospital Hill student apartments and associated parking garage. This revenue-bonded project reflects another great public-private partnership, which included key partnerships with the City of Kansas City on property acquisition and the Troost Avenue streetscape improvements, and the state through the Missouri Development Finance Board tax credits. This project provides the first UMKC housing on Hospital Hill and serves as a key part of our student success plans for the health sciences. The overall Hospital Hill Campus Master Plan highlights projects that provide critical renovations and strategic additions to the School of Medicine and Dentistry, as well as expanded common facilities to serve the library, teaching lab, and research lab needs of all of the UMKC Health Sciences schools. These common facilities better serve the interprofessional educational model that's becoming an important factor in the way health professionals are both educated and practice in the real world. UMKC's Hospital Hill campus is well designed for this type of instruction, and we feel that our faculty are thought leaders in this approach. Consistent with the University of Missouri System's STEM facilities priorities, we want to highlight the renovation and strategic addition to the School of Medicine building. 1970s era building, so like the previous project we discussed, has a very high level of deferred maintenance in the key building systems. The facility also requires significant programmatic upgrades to the student-docent units and study areas. And the docent units within the School of Medicine are really where the majority of the team-based learning occurs in that program. The buildings also require programmatic adaptation in their research and other support facilities. Finally, the 2014 Master Plan for the first time speaks to the creation of a third campus, the downtown campus for the arts, which would be anchored by our Conservatory of Music and Dance facility. The Downtown Arts Campus will give our severely overcrowded conservatory the space it needs to maintain and enhance its current level of excellence. It will stimulate additional development downtown and in the Crossroads District, and will bring hundreds of daytime customers to existing and new businesses. The project will add vital youthful energy and artistic activity to the urban core every day. And it also will serve to open up space on the Volker campus, which will allow other programs to grow. This $96 million project is well over halfway to its $48 million private funding goal. On the momentum of two significant gifts, the first one being a $20 million challenge grant gift, and the second one being a $6 million land gift, UMKC plans to be raising all private funds and submitting this project to the board next year for consideration for the State Higher Education Capital Fund, or 50/50 program. We recently selected the design team that will carry forward the concept and execution of this project, with the aid of a public urban design charrette process. And that process saw 250 people turning out on a beautiful Sunday afternoon to the Chamber Boardroom at Union Station to view the presentations. It's clear that Kansas City is very excited about this project, and we look forward to sharing more with you in the future. Again, we thank you for the opportunity to share these highlights, and for both the Chancellor and I, we'd be happy to answer any questions you have at this time.
Let me ask a question about the students in these programs. Will they take primarily all of their courses on this campus? This
You're
new
speaking about
campus?
of the conservatory program?
Yes.
So the Conservatory of Music program's a very unique program, and it's probably different even from some of the other music degree programs that exist on other campuses. It's a very intensive program, so as conservatory students, you actually take a higher percentage of your courses within your performance area, whether that's an instrument or voice or something like that. We use distance educational technology right now to teach courses on multiple campuses. We just opened our third site for our pharmacy program. So, one possibility could be that the students that are in the conservatory, may be taking their introductory freshman English course or history course or something like that, and it may be utilizing that distance education technology where, instructors here on Volker, or they may be using the bus system, or we have classrooms that are obviously located up in that building as well, so there could be courses that are taught up on Hospital Hill. I would tell you our students, as we've seen here at UMKC, and remember, we've operated as a two-campus system since the mid-1970s, really if you consider our dental school since the 1960s. So our students and our faculty and staff are already clued into that idea of being a multi-campus entity. And I think as I mentioned on the one map there, we're actually a very short distance from the Hospital Hill campus to the conservatory. So the students, we haven't decided exactly how those kind of core courses are going to be taught, but we know we have several options there, which could include the use of educational technology where courses are actually taught simultaneously on two sites.
So you've dealt with that problem? Well, the problem I see is students going from one class to another that are on a different campus. You almost, as close as they are, they're not close enough that you can move in the 3 or 4 or 5 minutes or whatever you allow between one class and another. So that doesn't work, so you have to make it work some other way.
And I think I would say we've come to a final determination, Curator Good, but I would say that I think the most likely scenario there is that we will use classroom technology to where the instruction will be brought to the student rather than the student going to the instruction.
It seemed to me you'd almost have to do that to make that work.
And again, that's something that we've done. We know how to do that, and we've proven that we can do it, and that the student outcomes are consistent no matter which site you're on, which is always important, whether you're where the instructor's live in person or whether they're there with the technology. And based upon our experience, we've shown that they can be consistent results in both locations.
Dean Whitty has also talked about having a different starting time for classes at downtown, so that it would give students more time to move between courses that they might take here and courses they would take on that campus.
It has worked well with the medical students. There's a lot of interdisciplinary coursework in the first couple of years of this particular medical school. And I don't think the medical students have objected to that. And I thought it was instructional this morning that 60% of those who are in the new housing on Hospital Hill actually go to the main campus. That corridor is going to have increased portability because of some public transit that is going to be available to the students in addition to the Kansas City Area Transportation Authority.
Transportation, is that university or city or a combination?
It's a combination, actually. The transportation, 4 years ago, our students approved a transportation program with the city's Kansas City Area Transit Authority, which is our bus system, and will actually soon be our streetcar system as well. And so they pay a one-time, about $14 semester fee, which gives them unrestricted access to any city buses. And UMKC is ideally situated for that purpose. When you look at this map and you see we're here on the Volker campus, here's our Hospital Hill campus, here's where the Conservatory Music and Dance would be, that's where we play our basketball games, and you see these two routes that run north-south, and those are what's called, in Kansas City we call them our MAX lines. They're like express buses, basically, that run on a more consistent schedule, fewer stops. They're distinct. They actually look different than all the city buses. And so we just sit ideally situated with these campuses to take advantage of that transportation. And we do also run a single shuttle bus that's a UMKC shuttle bus. And actually, I would say we probably use it as a way of helping students that may have a little bit of a transit phobia or something like that kind of work through it. But in the 4 years we have had this bus pass program, every year our ridership has increased by about 30%. So our students are very comfortable with transit, and they're using it more and more every year.
I think the students at the conservatory are so excited about the possibility in the future because of the proximity of the other arts, and in particular the Kaufman Center for Performing Arts, which is, if we had a jewel being the Nelson culturally, the Kaufman Center is certainly a close second now. It is the ultimate performing arts venue and much more used than many of us thought it would be. And so both the professors and the students like that proximity, as well as the ballet moving from Westport years ago down in close proximity to the Performing Arts Center as well downtown. That isn't to say that everybody in the community agreed upon the siting, but I think the vast majority are supportive of it.
Is that in your
That does,
presentation?
I'm sorry, yes, that does in my presentation.
Councilor Martin, do you have anything else?
No, I don't.
Okay. Thank you very much.
Thank you.
Okay, the next item on the agenda is a development on the St. Louis campus. I'm involved on one of those boards as a appointee, as a public member, not as a curator, so I'll recuse myself from chairing and participating, and David's going to take over and chair that portion of the committee meeting.
Chair Good, before we move from item 1, I think we need to vote on the
Vote on that?
on the
Okay.
UMKC master plan update.
Okay, can I have a motion to approve the resolution? Is that, are we approving that today? I thought we were not.
I believe it's an action item, isn't it? We're approving the update.
Okay. Okay. Will a member of the committee like to make a motion to
I so
approve the
move.
update?
Second.
Okay, call the roll, please.
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Good?
Aye,
Okay, all committee votes in favor?
thank you. I'll now move to the board that we approve the update.
Do I have a second?
Second.
Cindy?
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Downing?
Yes.
Curator Good?
Aye,
Curator Hendrickson?
Yes.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
Okay, all votes in favor.
Temporary Chair Bradley.
Temporary, yes. I'm temporarily on the board, too. Okay, now we'd like to have Chancellor George explain to us, they are requesting approval, UMSL is, for this is the longest corporation name I've ever heard, Great Streets Natural Bridge Community Development Corporation. Is that right? Where's Chancellor George?
Right here.
Oh, there he is. Okay.
Thank you, Curator Bradley. Let me just give you a context for what this is all about. We go back to 2002. We just heard about the master plan for UMKC. We do regular updates on all the campuses. And in our update in 2002, we had approval from the board for the concept of a Great Streets Initiative University Square. And you've got a map which shows the University Square. It's bordered on the top by I-70, bordered on the left by I-170, the lower left by St. Charles Rock Road, and then Lucas and Hunt. And the kind of brownish, reddish area there is the university. And we're going to be talking now about Natural Bridge Road, which cuts right through the center of this University Square. Also, it bisects, if you will, the North Campus and the South Campus of the university. In 2007, we made a proposal to the East-West Gateway Council of Governments. This is a St. Louis metropolitan public agency. They don't have funds themselves, but they control funds, and they approved a project for us that we would fix up Natural Bridge Road from Route 170 all the way to what we call the Wedge, which is Lucas and Hunt. It's a $26 million project. They initially awarded $6 million of planning and engineering funds. A lot of it was federal money, some of it from the Obama stimulus funds that were awarded to different areas, and about $14 million to actually fix up for the phase one from Hanley, and you can see Hanley Road, which is about, maybe 30% over from the left, Hanley Road all the way to the Wedge, or Lucas and Hunt. That's a $14 million project. It's all being eaten up right now. This originally was the main thoroughfare instead of before I-70 was built there, and it had 5 lanes. It's now going to be eventually 2 lanes, bicycle-friendly, pedestrian-friendly, hopefully more inviting for retail. In fact, right now it's all torn up. So for those of you that happen to be in St. Louis, be careful as you go near the university because things are really torn up. This is phase one. Phase two is another $6 million. That hasn't been funded yet, but we fully expect that to be funded. The partnership, and this fits in with 2 of our themes of our strategic plan, community partnerships being one of them, and the UMSL experience. So it's in line exactly with our planning. And our partners include the City of Normandy. They made the pitch with us to East-West Gateway Council, North County, Inc., East-West Gateway itself, Great Rivers Greenway, Missouri Department of Transportation, City of Normandy. I do want to mention that no funds from the university have been expended on this per se. I mean, you can maybe argue in kind, my time that I give to it and so forth, but no university funds. And on top of that, the St. Louis County has awarded a grant of $250,000 to administer that. So the question, or the ask, is we have 2 entities. One is the so-called Community Development Corporation. This was established last year. It has 3 members on the board, myself, Wayne Good, Betty Van Ohm. Betty Van Ohm is the Assistant to the Provost for Public Affairs and Economic Development. And this is a nonprofit 501c3 entity, and this is the entity that accepted the funds, if you will, the grant funds from the St. Louis County. Under that, then, is another for-profit entity called the Urban Redevelopment Corporation. We call it the 353, and that's simply named after Chapter 353 of the Revised Statutes of Missouri. That's appointed by the board of the CDC. It's composed of a campus representation or representative, and that, I assume, would be the Assistant to the Provost for Public Affairs Economic Development. The Mayor of Normandy. We're located, part of our campus is in Normandy. Part of it is unincorporated in some other areas. The President of Beyond Housing, which is a whole other entity. I can describe that if anyone's interested in it. The President of North County Incorporated, and the Director of Elections for St. Louis County, which currently is Rita Days, a former senator from our area. So what we're asking for is approval for these 2 entities. The Chancellor would have the appointing authority for the board of CDC, which again, currently now has Wayne Good on that board. And I've got
Any
Steve.
questions?
Oh.
So I need a approval for the Urban Development Corporation and Redevelopment Corporation and the Community Development Corporation.
Both, yes, the
Both of them.
CDC and the 353.
All one motion?
All in one, yes.
One motion.
If you're willing to do all in one.
So could we get a motion to that effect?
So moved.
I'll second it.
Curator Bradley?
Yes?
Curator Covington?
Yes.
And Curator Good, you recused?
Abstain.
Okay.
Now we'd like to present it to the full board, motion to approve the two corporations.
Second on the full board.
I'll second.
Cindy?
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Downing?
Yes.
Curator Good?
Abstain.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
All votes in favor.
Chair Good, I believe all we need left is a motion to adjourn your committee.
So moved. Second.
Second.
So moved. Whatever.
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Good?
Aye.
Okay.
Next on the agenda is the Academic Student and External Affairs Committee. In Curator Stewart's absence, Curator Cupp will serve as chair today.
Mr. Chairman, we have one informational item, and Vice President Canor will be giving that.
Curator Cups, thank you. This morning we heard Secretary Jason Kander give his remarks about the Royals game and the clap, so I'm not going to do that, but I do want to let you know that I'm not a Royals fan just come lately, so if we have the slide that I hope would come up, let me try this here. There we go. That's my slide of Cookie Rojas whenever he was a card that I had as a kid. So I just want everybody to know that I'm not a Johnny-come-lately. I really am a Royals fan. Today I just want to kind of go through briefly, talk about the year, talk a little bit about veto session, and then we're going to talk about our communications efforts that we've had. So we had an excellent year in higher education in general, and that takes many facets. So if you can see, since 2001, we were really at a record high, given that very long time frame of about 13, 14 years. Many friends had to help us get there. Obviously, having a governor and a legislative leadership is critical. Having the leadership of this board, of the president, the chancellors, where the political folks in Jefferson City have the confidence in what we're doing is key. And then also having our alumni friends and the citizens of the state feel good about where we're going. So I think there's many reasons why this happened, and obviously, hopefully having an economy that is coming back that allows us to have those numbers. And so that's where we ended up the year on the legislative front from a core funding. Also on the capital side of things, we ended up, again, at a very high number, $67.1 million. Again, that's the highest since 2001. The 2001 consisted of the Bond Life Sciences Center, some of those kinds of things. You'll see another blip there. That was the Mizzou Arena. And then a little bit later on out was the Lewis and Clark Discovery, where we got a few, about $10 million in that. But really, it's been flat. And so for us to kind of crack back into the capital side of things and have the political support there has been well worth our efforts, and we hope that we're going to be able to keep that going as well. On this capital side of things is clearly the 50/50 projects that we've talked about a little bit here today. $7.4 million for the Free Enterprise Center at UMKC, $10 million for the College of Business Administration building at UMSL, $1.2 million for the Experimental Mind building at S&T, and $10 million Applied Learning Center at the MU College of Business. Those were all matched with the state and the private, and so very good response from our legislative friends in Jefferson City on our 50/50 capital. There was another aspect, obviously the Lafferty Hall and the bonding proposal that went through this year. Legislators supported a revenue bonding package up to $400 million to raise the cap. The Board of Public Buildings, which has the governor, lieutenant governor, and the attorney general on that, would have to issue those bonds. That has not happened as of yet. One project that was on there was the Lafferty Hall at College of Engineering at MU. That's $38.5 million. The legislative body did put $10 million in for the first payment. And so ultimately, if you take the 50/50 cost share projects and the bonding for the Lafferty Hall, we ended up we would have about $104 million total construction across the system. It would create about 199,000 square feet in classroom and laboratory space, and it would create more than 1,600 jobs. So I think that really highlights the perfect public-private partnership
to move economic development and how the university and our alums and donors and the political folks in Jefferson City can work together really to move the state forward. On the financial aid side, we had a very good year there as well with the Bright Flight program being increased by $5 million to $22.6 million. That affects about 3,000 students at the University of Missouri. Access Missouri is a $78.5 million scholarship. It was increased about $15 million. That affects about 10,500 students who receive scholarships. So just another aspect that those funds don't necessarily come directly to us, goes to the student, but ultimately it benefits our students in a big way. So one of the things that was kind of determining was how the veto session was going to end up this year. And so there were 10 tax bills that the governor vetoed this year that were going to total around $400 million in loss in revenue if they were overridden. Happy to report today that only 2 of those were overridden. That was Senate Bill 829 that revises the burden of proof on tax liability questions with the Department of Revenue, and Senate Bill 727 that eliminates sales tax for farmers market. Take those 2 together, combined, it was only about $3 million in revenue that would come off the books. So ultimately, very small tax cuts bills that were overridden, which put us in a good position then for the governor to release our core funding, of which he did immediately the next day. And so our performance funding increase was released for about $21 million. And so that took place, but we still have a few restrictions in place that affect the university, and you can see, hopefully you can see those there. It's the $10 million of operating funds for the medical school expansion with Springfield, with Cox and Mercy hospitals, the $10 million bond payment for Laffery, which I had mentioned earlier, that was also restricted, and then the $28.6 million total collected for those 4 projects on the 50-50 matching. And so what's going to be kind of determining as we look forward from here on out is what are revenues in the state going to end up doing that allows the governor then to come back and take a different look at those facilities and some of the things that he's restricted. So we need strong revenues for the end of the year. As you can see before you, the end of the year, we were down 1% for the fiscal year 14. So fiscal year 15 has started. We're in the first 3 months. I'm off just a little bit to date. The budget office put out the new numbers. It's 3.8% is what September ended at. But my point here is that the first 3 months of the year are looking pretty good and fairly strong. And so hopefully as we move on through this process over the next few months, that'll provide confidence to go ahead and fund some of these capital projects and some of the things that we still have restricted. So my message to you is keep spending. So revenues will keep going up for the state. But that's kind of where we are after the veto session with our budget and where our items stand. I'll be happy to answer questions there before I move on, or I can keep going.
I have a question on Laffery.
Yes, sir.
So I'm not sure I understand the implications of the restriction on the $10 million bond payment. If that is released, does that mean that Laffery improvements can move forward for the full 38?
So 2 things have to happen. I'm going to make sure I get the correct terminology here. But the Board of Public Buildings has to actually increase release the bonds or bond capital cap first, and then the $10 million would have to be released. So the $10 million is actually the payment for that. So it's kind of 2 things. So the board would actually have to do the bonds first, and then you'd have the $10 million there that's being restricted, but that would kind of serve as funds for the payment of it. So you could release. If you did that, all $38 million would be ready to go for Laffery.
Is it a significant issue about the board releasing the bond funds? I mean, that's the first I'd heard that was another hurdle we had to get over.
Well, I think it's just a matter of kind of where's the comfort level on the revenue side of things, and I think hopefully, as I'm trying to show on this chart, that confidence will come along as we move along here. So I don't think so. I think we have good supporters there that Just kind of need to see some things with the revenue.
So all 38 million is from the state revenue bond? Is that what you're saying?
Yes.
Yeah, and so that would all be released by that three-person panel, right? The governor? and
Right.
Lieutenant governor, and who's the other one?
Attorney General.
Attorney General, okay.
And so I think also on that, by the way, there are, and I don't want to, but there's been a little over $6 million that the College of Engineering has raised as well, that would then be able to be supplemented on top of the 38. So you would have a bigger package probably that would come before the board than just the 38 million.
This isn't a 50-50 deal, this is not.
This is not.
This is not.
It's not. It's a different category. So one of the things that we'll have to deal with in about a month from now that I thought I would bring to the board is obviously an election. So what's kind of the year going to look like? We have 17 seats that are up in the Senate. 2 members of the Senate were term limited this year. 6 others are not running or running for different offices. So you have a matter of 6 seats that are going to be changed in the Senate. In the House, all 163 members are up. 9 members only were term limited, but 35 members chose not to run, so they're either running for a different office or doing something different. So all told, we're probably going to have about close to 50 new members in the House and the Senate that we're going to be dealing with come January. So obviously, term limits, you've heard me say before, is one of those challenging things that every 2 years we get a pretty good size group that it comes time to re-educate on the benefits of the university and what we're doing statewide, and this year is going to be no different. There are a few ballot initiatives that I thought the board might be interested in. Amendment 10 is going to allow lawmakers to override the governor withholdings on the budget, also prohibit the governor from using revenues in his budget that require passage of legislation that's not been approved. That's an Amendment 10 that's goes straight to the ballot. Amendment 2 is related to child sex abuse prosecution. Amendment 6 is related to early voting. And Amendment 3, teacher evaluation initiative, which is on a K through 12 level. So really, Amendment 10 is probably one of those things that we'll keep an eye out for as we go forward. One of the things that we put before the board a little over a year ago was this map. And almost a year ago, we embarked on our rural Missouri education plan, if you will. Curator Stewart is not here today, but I would mention that just because we have a rural Missouri plan doesn't mean we forgot about Kansas City or St. Louis and what we're trying to do. But if you look at this map, this is the current makeup in the House and the Senate in Jefferson City. And so Republicans clearly are in charge in Jefferson City, and if you look at where most of those Republicans are coming from, they're coming from rural Missouri. 21 out of 22 states, 21 out of 22 Senate districts in the state are considered rural that are from a Republican side, and 95 out of 105 are rural Republicans on the House side. And so that kind of gives you a basis of where the majority party's influence is coming from. We only put that up there as an example of one of the things that we need to certainly do, and when we take a look at, is what's our communications with, and our plan with rural Missouri from a University of Missouri standpoint. What's our messaging? How are we going about doing it? And so we embarked on that about a year ago, and I just wanted to share some of those results with you. As what's in our strategic plan is to advocate for the support of higher education in the University of Missouri and plan a statewide outreach campaign. And so we've been doing that, and here are some of the results within our first year to be able to kind of take a look at how are we doing. From July 1st, 2013 to June 30th of 2014, if you kind of look down through here and you kind of look at the placements, and the placements doesn't mean we necessarily place something into a paper or on the radio, but it could be part of that, but it's just how many different articles or mentions were there, and this is how we track that. So we had an increase on our placements. The Show Me Value tour that we've brought before the board and had placements directly related to those were at 51, so we increased that. As you know, we increased the number of times that we had the president out doing the Show Me Value tour around the state. And so then we looked at how many of those were kind of proactive things, because what we actually did were a cause for that. And just about 25% of that was actions that we took that led to a proactive placement. Our positives increased. And a positive, the way we define it is, it may not necessarily every article or mention may not be the university's great, but if it's got our message in it and the message that we've been trying to get out there, we consider that to be positive. On a negative side of things, it could be that it didn't have our message and it wasn't a good story, and so that's how we kind of monitored those. Our proactive circulation is increased immensely, and so how have we done that? It's been by radio, which is the first time I can think of that we've had a president of the University of Missouri actually actively doing radio interviews around the state on a weekly basis from one end of the state to the other, doing op-eds and increasing those op-eds. And hopefully you've seen some of those. Certainly this Show Me Value tour has been a big increase in helping us out there. We've also had a lot of help in putting our mentions in like the Farm Bureau or the Rural Missouri magazines, who hit a lot of Missouri citizens. And so we've gone about this in not just one way, but multiple pronged approach to get our message out to the state of Missouri. So what's the first quarter kind of look like, if you will, for us this year, is our placements are about the same, but really the number I want to bring to you is compared year over year is the last number, is our proactive circulation and why that is. We're at 1.7 million, and that 1.7 million, a few of the things that helped us out with is not only the editorials that we've done, but again, putting our publications of the Show Me magazine of the Missouri Farm Bureau, which reaches 110,000, Rural Missouri magazine, which has reached 1.3 million. This gives us another alternative to get our message out in many different ways. And so we're going to continue to look for that. We're going to continue to look for ways to get our message out as we go throughout the year. And one of those ways that we're going to continue to do is do the Show Me Value tour. President Wolf was in Chillicothe just last week and had the ability to stop there. One of the things the board challenged us to do last year was to use former Board of Curators to help us out. Ed Turner, former Board of Curator in Chillicothe, helped organize a community breakfast. And so that was very helpful. We went to Wireco World Group, saw a company, heard how we're helping them and how we can be of help to them. President visited with over 400 middle school students and then attended the Ag Research Field Day at Linnaeus. And that's kind of what the Show Me Value tour looks like in a nutshell. But this year, the chancellors are all going to pitch in and help out. So it's not just the president giving that message. Each of the chancellors are going to do 2 of the Show Me Value. And so what you're going to see is, I think, going back to this number here, is our circulation and our positives and how we're measuring all of this is going to increase, we hope, as we kind of start to spread this from just the president to others in the university. So this was the kind of a targeted approach that we gave this year to kind of follow up. So one of the things that we want to do is, after we do all these efforts on the radio and in the paper visiting, is we want to make sure we had something to leave behind. And so we sent this out to our extension offices, politicians, schools, the companies that we visited, and then we also really targeted the Show Me Value tour areas to make sure that back in Chillicothe that we have this leave behind, so our message keeps on going and we keep kind of pounding this away. And so my final point is that this isn't kind of do this one year and then we quit because we have really good numbers. This is going to be a long-term effort over many years for us to really start to penetrate and get our message out about how the University of Missouri is serving the citizens of the state. And we think we're on the right path. We're going to continue to do a lot of different things as we move forward, but I just wanted to bring that to the board because it's been about a year since we kind of kicked this off. Happy to answer any questions.
Steve, I totally agree on that last point. You guys are on the right path, and I commend our president for spending the time and effort, and it's a lot of time and effort that he has gone traveling all over the state, and I think we're all tremendous beneficiaries of that, every campus and all of us.
Yep.
So, thanks.
Thank you.
I think our remaining action item will be in closed closed session, so we will recess at this time.
Next item on the agenda is the Combined Compensation and Human Resources Committee and the Academic Student External Affairs Committee meeting, and I assume Chair Phillips will chair this portion.
I'll introduce the subject and remind people that we've been working for several months toward amendments to the rules and regulations for essentially both student and employee conduct, different sections of the current rules and regulations. We did empower President Wolf early to make some executive order implementation, and so that has been done. Since that time, we've had a team led by Steve Owens and his general counsel staff, by Daniel Swinton, who's our consultant, who I see in the back of the room, and by Deborah Noble Triplett, working very hard on trying to put together state-of-the-art as it is today on, what is it, October 2? But it continues to evolve. We do have an action item. I think we're running a little late today, aren't we?
Yes, we are.
But this is
Thank you.
hugely important. And I think if we could have a brief overview. I know that the proposed changes have been published. We got, I think, the final of the current state-of-the-art, even though it may change a bit in the future. A couple of weeks ago, it's in our open agenda, and I know the public is very interested. I would say commendations to the President for his early decisive action in taking leadership role, to the team and to the Board of Curators, who I think has been very engaged in the project. And the consultant has led us through very complex issues. That's my introduction. Steve, do you, or does, we do have the availability of Daniel and Deborah. If anybody wants to come forward and make any comments, or if board members have questions they wish to raise. We do want, to have an open discussion here. Pardon?
The President has a presentation.
President's going to do the presentation. Proceed. While he's coming to the forefront, he got good reviews in the local paper in Columbia. I say good reviews. One of the rare editorials that was complimentary of his leadership of a president. So that's a rare charm in any university, I think.
It is rare, especially with Hank Waters. The only thing that I can probably give credit to for that positive comment was I used to work for him. I was a paper boy back in middle school for the Tribune, so maybe he's given me the benefit of the doubt. But thank you. Curator Phillips did appropriately say we've put a lot of time and effort into this initiative, and we've also been part of this national conversation on how to better address the problem of sexual assault on campuses and how to provide fair and equitable processes for resolving allegations of sexual assault. This national conversation is getting louder. Obviously, what we've all read and heard as what's transpired with the NFL puts additional gas on this fire. But what is necessary is that I update the board and the rest of you here today as to what has transpired since the beginning of the year. And I'm going to talk about what has gotten us to this point, where we are, and what you can expect going forward. As a brief reminder as to what happened in January, on January 26th, I announced 3 independent actions. I challenged the Board of Curators to perform an independent investigation of legal matters pertaining to Sasha Menyukuri, and they rose to that challenge. I also challenged my great 4 chancellors to put together a sexual assault mental health task force to have a comprehensive review of existing policies, existing resources, practices, investments as it pertains to sexual assault and mental health. And the last thing that I announced in January is I was going to put money where my mouth was, is I was going to put resources up towards those resources and those investments necessary to achieve our overall objective of a safe and secure campus environment for all 4 of our campuses. Shortly after the January announcement in February, we named the Sexual Assault Mental Health Task Force leaders on the 4 campuses, and I gave them 3 objectives. The first objective is I want you to be introspective and assess where you are. First of all, inventory where you are, identify what resources are available, what existing practices and policies are in place. The second thing that I asked the Sexual Assault Mental Health Task Force to do was to assess where you are, and we needed help on that phase. We really needed somebody from the outside to have a very clear view as to where we are, and we engaged NCERM, which stands for the National Center for Higher Education Risk Management, at that time to help us with the assessment of our current position. And then the last phase that I challenged the task force to perform was based on the assessment of where you are, make recommendations on investments that we can make to improve your position, again, to realize our overall objective of the most safe and secure environment for our 4 campuses. After that challenge to the task force, I'm very proud to say they got to work and they performed those 3 phases on a timely basis and a very thorough basis. But after we got into this, we recognized that we need a lot more help, external help, than what was available from a resource standpoint as well as expertise. So we extended the NCERM contract to also include their help in training our people as well as provide additional consulting services. And so that contract was announced in July, which is again another example of further investment that we needed to make as a system to support the initiatives across our great 4 campuses. So that's what got us to today. So where we are right now is the task force, the 3 phases that I asked them to perform are completed. We have recommendations from each of the 4 campuses and systems relative to additional resources that they need. Yesterday I talked to the chancellors and we have released part of this money. We will spend way in excess of $1 million on support of these sexual assault mental health initiatives that are important to us. Also on September the 23rd, I issued Executive Order 41. I'm looking for approval from the board today on the Executive Order 41. Executive Order 41, after September 23rd announcement, we also had each of the chancellors send out an email to their employees and then a separate email to their students. In both those emails to their employees and the students, they discussed the Title IX officer, the Title IX contact information, the purpose and the background as to why this executive order took place. They also identified very clearly the support services that are available to employees and students on that campus and the contact information on that. So we followed up the executive order with specific communiques to our important constituents to make sure that this gains traction and we see improvements. Also, we have started training. We've trained over 100 people in the last couple weeks. Specifically, the roles that we've had to train individuals on each of the campuses are the Title IX coordinators, the deputy coordinators. They specifically received 4 days of in-depth face-to-face training. Also, the investigators have been trained in the month of September, and we have a continued plan to train additional people. What's happened right now is, as I said up front, is we're involved in a national conversation. This conversation is also occurring on our campuses. We're seeing more questions, more involvement in faculty and students and other employees, which is a very, very positive thing. We're raising awareness of this very, very important initiative. I'm going to show you towards the end of this presentation an example of this increased awareness and what has come out of this. The executive orders that I issued in September were necessary for a couple of reasons. The primary reason as to why these executive orders were issued on my behalf was we have to improve the safety and security of our campuses and also create a culture of respect for each other. So that was the driving reason. Second major reason was we have to be in compliance. In compliance, regulations come down from the federal government, OCR, Dear Colleague letters, and what we found as we looked at where we were with existing collected rules is that we had to better define our existing prohibitions against all forms of sexual discrimination as they relate to members of the university community and to establish an improved resolution process for all forms of discrimination when the accused is a student or a student organization. So that's where we are today, but we haven't completed our work. We now have to further refine and define additional policy relative to faculty and staff. And the good thing is we have work groups representing faculty and staff that are engaged in this conversation so that we issue the appropriate executive orders going forward. The other challenge that we've got is training, and it's training, training, training. We can't do enough training, but all the students that we have out there, all of the employees need to be trained, and we have to do this in a very quick manner. We'll use all different approaches and mediums to get that information and education out. Specifically, the ones that are in front of us that are high priorities is the hearing panels that are identified in these executive orders. Those individuals that sit on these hearing panels have to be trained so that the issues that we've got already identified that are in the Title IX offices, we can adjudicate those with trained people. Also, on top of the hearing panels, the appeal officers, victim intake, advocacy, and mandatory reporting training. These are the priorities that we've got and training that is being scheduled as we speak. The other thing that we're working on right now, and our consultant is helping us with this, is we need to go out and take a look at our prevention training and our prevention programs. Again, understand the effectiveness of these, understand the reach of these programs, and think about systematically across the system, can we execute training programs that touch more people on a frequent basis, that educates them, that changes behavior in a way, again, that we achieve our objective of safety and security. Also, we have to get out to the focus groups on the 4 campuses and understand how these executive orders are being received, how these changes are taking place. And we have, as part of our contract with NCURM, 3 days on each of the 4 campuses where we can start to have listening sessions as to what is going on and do we need to make some additional investments or changes. So what I had projected early on when we increased the awareness and conversation about this is that we would increase the number of reports to the Title IX officers for sexual assault. And in fact, that has occurred. That is a good thing. It is a good thing that the majority, unfortunately, the national statistics suggest that the majority of people that have been sexually assaulted, anywhere between 88% and 90%, they don't come forward. And we want them coming forward because they badly need the support and services so that they can work through the situation and also that we can prevent this from happening to somebody else. So the reporting is going up, which is a good thing. Now we need to start to establish the metrics and the understanding of where the assaults are occurring or why they're occurring so that we can start to be more proactive either in training or proactive in making specific areas on our campuses a more safe and secure environment. Also, what the federal government has recommended is you need to baseline where you are relative to student opinion and employee opinion on knowledge of what sexual assault means, on knowledge of where resources are available, on knowledge of has it occurred to you personally. We do need to do that baseline as the federal government has proposed, and we will be doing that because that is what we build off of when we understand where we are currently. So that's additional resources or additional things that we will be doing very, very near term. So let me go to a next conversation about what we can expect from the national and societal conversations. The White House on September the 19th announced the It's On Us initiative. It is another example of how we shift cultures on our campuses to be more respectful. And they have challenged student leaders to sign up for It's On Us, and then in the November time frame, they're also going to challenge campus leaders to also sign up and take the pledge or oath of respect and to work on improving the safety and security. As you might imagine, we'll be heavily invested in that, and we also have student leaders that have already signed up for this program. Some of you might have read that there's this national legislation being proposed. Senator McCaskill has been a leader in this area. I've had the good fortune to have a lot of conversations with Senator McCaskill. The bill that she is proposing is called the Campus Accountability and Safety Act. CASA is the acronym. We have sent a response to Senator McCaskill about some recommended changes to her proposed legislation. We are also working with the associations that represent higher education, which is APLU, ACE, and AAU are the primary associations that we have been working with. Our comments are consistent with their comments, so as a collective whole of higher education, we are representing in one voice what we like about this legislation and what challenges us about this legislation. Recently, I had the opportunity to go to D.C. and meet with Senator McCaskill. Out of that meeting, she said that before we bring this legislation to the floor for final approval, we want to make sure that the universities are behind this. So she is very, very eager and willing to work with universities to make sure that this legislation represents the needs and the interests of our communities. She also has announced that she's going on a listening tour. She has 3 stops that she is going to: St. Louis, Raleigh, and Columbia. The format is a reverse town hall where she gets to ask questions of leaders just to, again, appreciate where we are on these 3 locations, as well as, again, get a deeper understanding of what are the needs on our college campuses. The Department of Education and the Office of Civil Rights continues to modify the language. So it's a little bit of a moving target, and we're trying to stay up with it as best possible, as well as continue to give them advice. We do have in the CASA legislation that was proposed by Senator McCaskill, there is the opportunity for the federal government to fine an institution 1% of their revenue. The previous fine was could be called nuclear, which is we'll kill all the federal funding, which includes your Pell funding as well as any federal grants that you have, which they never took that opportunity to do. But they have fined institutions like Montana recently for poor performance relative to Title IX investigation. And that 1% is significant. For example, if that 1% was levied against MU, that would be a $14 million fine. So that's a fairly significant dollar amount, which obviously concerns us based on the size of the fine as well as what those dollars would be used for. And we certainly have given that input to Senator McCaskill and others. So moving towards some summary comments that I've got is our aspirational goal remains the same, is we want to change the culture on our 4 campuses, and we want to make sure that we have a safe and secure environment. We've made progress, but this is in the category of it's a never-ending journey. You have to continue to understand where you are and continue to improve, and we won't be able to do that without a lot of collaboration and a lot of education for our constituents. One of the things that I've heard recently is, and it is criticism from our important constituencies, is you're moving too fast. You're moving way too fast on this. And if I have to take that criticism of we are moving too fast and that we save one person from being sexually assaulted, I'll gladly take that criticism. What we need out there is increased awareness. We've got the increased awareness. What we need out there is definition of what is acceptable behavior and what's not. What we need out there is confidence that if you come forward, you know what will happen to you in terms of support as well as resolution or adjudication of that. And without these changes, we were exposed, and also, I believe, we weren't victim-friendly, and we weren't creating an environment where people were confident to come forward. So I accept that criticism, but I also accept that we need to continue to have conversations with all constituents, including faculty, employees, and students, and that if the executive orders that we've issued now need to be further clarified or modified or changed or enhanced or whatever, we should certainly be open to that. But this is really, this initiative is much more than just about being compliant with Title IX. It's much greater than that. It is about making sure that once we recruit students that they understand what the University of Missouri system and its 4 campuses expect out of appropriate behavior and how we treat each other as student to student, student to employees, employees to employees, and we have covered as best we can at this particular point in time where we are relative to employee to employee as well as student to student. But we're going to continue to work on those areas that aren't quite as clear as we should be. So one of the things I alluded to earlier in my presentation was with this enhanced conversation, there's been some really cool, innovative ideas that have come out of this. And I want to show you one that came from MU's Missouri Student Association, which is a video that they put together. We didn't ask them to do this. They just did this by themselves, but it's gotten broad circulation, and I think this is an example of what we need to do more of. Could you please roll the video?
Enough is enough. Enough. She was drunk.
Enough. They should have been more careful.
Enough saying he looked like he was fine.
Enough saying she shouldn't have walked home alone.
Enough thinking that this only happens to women.
Enough saying to man up.
Enough telling them they should have had their mace.
Enough. It's none of my business.
Enough. They always fight like this. Enough. She shouldn't have worn that.
Enough. All guys want it.
Enough. She was my date. She knew what was expected.
Enough. He didn't really mean it.
Enough. She was asking for it.
Enough of the blatant ignorance.
Enough standing idly by.
Enough is enough.
It's time for us to stand up for our fellow Tigers.
These are your sisters.
And your brothers. Your classmates.
And your friends.
It's up to us to make Mizzou's campus safer.
It is up to us to stop sexual assault and rape on our campus.
I will stand up against this social disease.
I will say something. I will make it my business.
I will do a green dot.
We
won't stand for it here.
We won't stand for it here.
We won't stand for it here.
Enough is enough.
It stops now.
I think that's a great piece, and as much as we can get this word out to students and employees on all our campuses, I know we will shift the culture and we will improve the safety and security. This gives you this concludes my update on Title IX. Curator Phillips and the rest of the board, what I'm looking for now is the board's approval for these revised rules, and that they remain in the form of executive orders to permit my ability to modify them in the future as we continue to progress in the state. So now back to you, Curator Phillips.
And I think your recommendation means to preserve your ability to modify, right?
Yes.
And your patience shows through and rubs off on others for this topic. Open for discussion before we put a motion on the table. Anybody have any questions or comments? We do have people here in addition to President Wolf who can answer questions if anybody has. Yes.
Chairman, I agree that we should approve this so the president could continue to work on this going forward for a period of time. But I think in the longer run, because of the nature of the governance of the university and the board of curators and so forth, I think eventually this should be shaped up into a place where the board can adopt it. And I think going forward from there, there ought to be a review of this policy by the board either annually or every other year, so the board is kept up to date. Because so many times, you know, we do things, we're all busy doing other things all the time, and things fall off the table. This is something that should never fall off the table in the future. So I think it ought to eventually be passed by the board, but there ought to be an ongoing review by the board. I know there'll be an ongoing review by the administration, which is good and as it should be. And I'd also like to thank Tim and his staff as well as the general counsel for the work that's done on this, because I think, you know, it's a good job. It needs some change, but it's a very good job to this point. We need to carry it forward.
Other questions or comments?
I'd like to comment. I would like to applaud the task force and President Wolf for all of the time and attention you have given to this. and seeking out feedback from various constituent groups. I would just like to take this opportunity to say that I think it's incredibly important at this stage to collect more feedback from students so that we can ensure that what we do eventually approve doesn't have any unintended consequences that we may have overlooked by not speaking with them in depth first. So,
Anyone else want to speak to the issues? Let me get a motion out with some formality so that we get this right. It is a little nuanced. The recommendation is actually coming from the Mental Health and Sexual Assault Task Force. So recognition to more than just the three and President Wolf, who we've already identified. And it would be to approve the revised and collected rules and regulations making up Executive Order 41, which relates to both the university's sex discrimination and student conduct policies. And it would be to approve the rules as set forth and that they remain as executive orders within the collected rules and regulations. Those would be attached to the motion. Do we have a motion?
So moved.
Second?
Second.
All right, so we have a motion on the floor.
What?
I do have a comment with the motion on the floor. I do think that our work is not done, either at the president's level, as I think you've acknowledged, or at the task force, and that there are issues here that will be nuanced maybe in weeks, if not months. So, Curator Good, I agree that this ought to come back to us periodically, but I expect it will come back to us, or that modifications will be made in the coming year. And that should continue its work. I do have a couple of areas that I would identify. One is I do think that we need to continue to look at who's going to be a mandatory reporter, and that needs to be clarified for students as well as employees. The policy, as stated, is great for the moment, but let's continue to work on that. I would hope that we would identify with clarity who's not a mandatory reporter or who is a limited reporter, and publicize who that is so that there will be safe harbors for people that believe they've been victimized to go to without putting it in a formalized chain. So that's the second wish that I have as we move forward. And I guess I really have four. Also to review the student conduct committee process and consider whether or not the dramatic change that we've proposed and is now part of the motion is the right answer as we go through this. And fourth, I commend the President for talking about prevention, but I don't think that we're keeping up with the social media. Running to a pole with a blue light on it is not what prevents immediate issues, but there are now apps, and there soon will be watches, I guess, including an iPhone watch that you could tap on to, and I hope that our university will be innovative and on the cutting edge of that. I think we are on the cutting edge on October 2, but I look forward to continued progress to be at the very cutting edge as these things come forward. So that's my comment. I wanted to get the motion out. We have it. Any other comments that anybody wants to make or questions? I'm not sure how often we'll have Daniel back here at a board meeting, but he's certainly taken a great leadership role in getting some ideas put forward. All right, Cindy, would you call the roll of the committee?
Yes, we did. Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Good?
Aye.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
Okay, you have all committee votes in favor.
We have a motion for the board.
Is there a second?
Second.
Cindy?
Curator Bradley?
Yes.
Curator Covington?
Yes.
Curator Cups?
Yes.
Curator Downing?
Yes.
Curator Good?
Aye.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Curator Steelman?
Yes.
Okay, all votes in favor.
That completes our action items. I think anything else that we have will be for executive session later.
Oh, it's the combined committee that needs to adjourn. It's,
The combined committee needs to adjourn. Move for adjournment of the combined committee.
Second.
Yeah, it's actually adjournment of the Academic Student Affairs Committee, as Comp and HR still has business tomorrow.
All right, would you call the roll on that?
Curator,
We recessed it because we've got to go into closed session on it also.
oh, still? Okay.
okay.
Are we in recess, or are we adjourning our committees?
If both of your committees still have business.
We do.
Okay, then there's no need to adjourn.
All right. We're both in recess, that's what I thought.
Great. Finally, we are running a little bit behind, but I'm sure Curator Chair Hendrickson will get us back on time. So we're turning to the Audit Committee now.
I'm not that good. The Audit Committee fortunately only has 2 information items today. And John Tverdick with PwC will review the internal audit quarterly report and follow-up reports and the internal audit risk assessment, as well as set forth for us the 2015 through 17 audit plan. JT?
Thank you, Curator Henriksen. I appreciate it. So today, we've got 4 reports that we want to give to you today. That's the work that we've completed since the last time we reported in June. And I'm going to go right into the report. So if we could move maybe to slide 4. Am I driving it here? Oh, it's down here. Okay. I'll take care of that. So here's our first report. This is the 340B drug pricing program at MUHC. It's a federal program that allows manufacturers to provide discounts on prescription drugs to eligible healthcare providers. In July of 2013, MUHC implemented specific software to improve compliance with this program. Our audit evaluated the key controls and processes related to the program and included a focus on controls to maintain compliance with the program. The scope of our work included the period between September 1st, 2013 through February 28, 2014. I'll tell you that the system implementation really enhanced management's ability to monitor compliance with this program. We had 3 recommendations. The first was a recommendation around the compliance monitoring processes between the Office of Corporate Compliance and those of the Pharmacy Department. And our recommendation was better alignment so that the effectiveness of the monitoring would be increased and there would not be duplication of effort. The second was around a recommendation of ensuring that proper documentation is kept around patient records for drug administration, which is important under this process. And our third one was the duties of administrating this program have been spread through several people, and we've asked them to consider consolidating that to increase the effectiveness of it. So I'll move to the second item, which was Mizzou Online Technology Infrastructure. I won't go all through the background here, but to know that our audit was really around the general IT controls around the Mizzou Online Technology Infrastructure. And the moral of the story is the IT controls are good. We had 2 comments. One was around monitoring user access, and one was around access for controlling servers and where they were at. But the results of this audit were very positive. The third one I want to go through is also at MUHC, and this is around denials management. So the healthcare, I'm sorry. The audit here The audit assessed the processes to manage the risk of denied reimbursement and revenue issue losses from denied claims. The scope of our work was from February 1st, 2013 through January 31st, 2014. We used data analytics and visualization tools, and the themes of our recommendations focused on the consistency of tracking of information and the monitoring of denials information and improved reporting. So we had 3 recommendations here. The first was to improve the tracking of denial trends. A consistent reporting methodology will allow for easier identification of the root causes. When things get denied, to understand the root cause so they can make remediation. The second one was communication between departments will improve the efficiency of getting to the proper payment to the institution. And the third was around general automation and moving away from some of the manual review processes, which will make the process more efficient. The fourth one is around meaningful use assessment. So the Health Information Technology for Economic and Clinical Health Act includes incentive payments for early adopters of certified electronic health records that achieve meaningful use. To achieve this meaningful use, providers must adhere to various objectives and report on clinical quality measures. Our audit focused on the assessment of processes and the attestation documentation that for both the eligible professionals and for the hospitals. We had 2 comments here. One was that to ensure that management maintains adequate documentation to evidence the completion and the sufficiency of the security risk analysis, which is required as part of this attestation. And the second one was around the reporting process when the reports are sent under the meaningful use and the underlying data that supports that reports. There were some differences, and our recommendation was to make sure there's a clear record of reconciliation, documentation, so when the audits do come in, that the university shows well as part of the audit process. Those are the 4 audits I want to go through. I'm going to move to the follow-up process. So you're used to this process where twice a year we'll come in front of you and we'll review all of the past due action items that came due in the last 6-month period. So what happens is the Internal Audit Steering Committee looks at all items that are due to be closed, and they look at those items to determine if they're past due, closed, or still in process. We come through and we audit a certain percentage of those. In this particular case, there were 35 items that came through in this 6-month period. We looked at 100% of those. 26 of the items were adequately closed, and 9 of them are still in the past due column. The first one that's up there around the accounts payable and P-card review, that's a matter of policy. You know, one of the items that we've talked a lot about is gift cards. And one of the items in this audit related to gift cards, and the university is taking this step forward to increase its policy and tighten the controls around how gift cards are obtained, how they are used, and the documentation. That one's nearly complete, but it's in process. The second one, really the rest of them around the benefit review process and the non-employment physician contracting are all equally in motion. Those are technology-based. Both of those departments are making some changes to the systems so they can drive the change that they agreed to in the audit report. That concludes my remarks on the 4 reports and the status. And we're going to move to the plan that is 2015 through 2017. And I'm going to ask my colleague Chris Leiden to cover that. But before I do that, any questions on the 4 reports or the follow-up items?
I have a question on meaningful use. In your more detailed report, you indicated that we had variances that hadn't been resolved, and the timelines were, I think, September 30 and December. And if we don't satisfy the federal guidelines for meaningful use, it has huge dollar implications. Or any of the overdue issues having to do with meaningful use.
The items that were related to timing, the one around the security risk benefit analysis was the timing and the documentation to support the statements that were made in the meaningful use. The items around the connection between the meaningful use statement and the electronic records was really a matter of reconciliation between the 2 documents to ensure that the items put forward are completely supportable in an audit process.
Well, you didn't list it as a high risk, so I trust the answer is we appear to be on track for satisfying meaningful use.
Yes, so we feel good about the work that the hospital system is doing, and our recommendations were really around improvement under audit and the attestation part of it.
Thanks.
You're welcome, thank you. Chris?
Okay, so I'm going to walk you through our three-year audit plan. So as you know, as you may know, we have a three-year plan, but we spend time every year updating that plan on an annual basis, but throughout the year, through discussions with leadership at the system campus, and there's an internal audit steering committee as well. We will update that on a regular basis. So the fact that we publish something that is 3 years, but just know that we continue to monitor evolving risks and adjust the plan accordingly. A little bit of background on how we developed the plan, and then I'll quickly take you through the system and then campus plans. We use a series of steps where we do analysis around student, financial, and HR data, institutional knowledge, as well as historical internal audit results are considered. And then external perspectives from within PwC, other higher education institutions that we serve, subject matter experts in functional areas, as well as what we can learn from other institutions. And finally, and probably the most important step, is the dialogue that we have with leadership across the campus and at the system level. Really two things: to understand the initiatives underway and key strategies, and also understand the risks, the broad risks, as well as risks facing those individual strategies. And through that process, we actually meet twice. First is to collect those initial perspectives, and the second is to come back with proposed audits and have a dialogue around prioritization of those audits and picking ones that are relevant to risks and make sense for the institution. And we ultimately do that to make sure we're picking audits that are effectively using the internal audit resources and dollars you put forth. Let me cover, these are the system-wide audits. I would define system-wide audits as something that is a shared service or a pervasive topic that exists across the various campuses. So in 2015, we have three. It's Hyperion post-implementation, that is the new budget system that's been put in place. Accounts payable centralization, so the MU campus is supporting that across the system now, and then merit-based compensation. For 2016, we will look at the IT funding model and really how IT is aligning dollars and allocating those dollars to strategic items. Student health and safety policy review, so obviously something very important which was just covered, and a lot of time and thought has been put into those policies. We will be working with management around making sure and objectively looking at to what extent are those policies being followed. And then change in configuration management, which is important for maintaining IT security. In 2017, we have 4 audits planned. That is the employee benefit plan, to look at some updates that are being made to those plans. Fiscal governance assessment. You may recall at the last board meeting, we presented to you a review relative to that, and management is going to be undertaking some changes that we want to come back and take a look at. An internal audit attack and penetration focused on IT security. And then finally, there'll be another 3-year risk assessment which take place. And as you can see at the bottom, there's a series of audits which are done twice a year to follow up on prior findings. So I'm going to move through each campus. The first item listed here is something new that I want to provide a little bit of perspective on. It's departmental controls maturity assessment. So in looking for ways to expand our reach and touch more departments and get a better pulse for what's going on, we are going to be doing approximately 10 to 20 reviews where we look at the attributes and risk indicators for departments that may require a deeper analysis. And through that review, we'll not only provide a summary of the state of the controls maturity at those departments, it'll also result in further audits to be done where there's further risks that we want to look into. And that will drive an additional audit each year. So for 2015, we're going to look at some of the constructions underway, as well as the School of Journalism. 2016, we're going to look at Arts and Sciences. And then 17 is the post-award process for research matters. At UMKC, in 2015, looking at 2 large schools with computing and engineering and School of Dentistry. 2016 is online learning. 2017 is student auxiliaries. And you'll see a row at the bottom of each of these campus slides for an additional department that will be selected based on the ongoing evaluation of the controls maturity. For Missouri S&T, we're going to be looking at the Office of Provost in 2015, 2 projects in 2016, geothermal project, which, as you know, it was an important undertaking that had some economic as well as environmental benefits, which were set out to be achieved, and we're going to look at the outcome of that project, as well as looking at the organizational structure review that campus is undertaking. And then in 2017, we'll be looking at the Corporate Relations Office, which the university is working to establish presently. At UMSL, as you know, there's a significant amount of construction going on there, and we're going to look at those projects this year. We're also going to look at the Missouri Institute of Health. In 2016, we're going to look at 2 of the larger schools with the College of Business, and then Fine Arts Communication. And then again, we're going to have additional departments selected. So MUHS, Dr. Williamson gave an explanation earlier of the new governance structure with an internal audit and corporate compliance committee that really sits and we come together on a very regular basis to talk about ongoing risks to the health center and really talk about, between internal audit and corporate compliance, how are we going to monitor those risks and provide objective reviews associated with those. So that process is going well. You can see the audits for 2015 that we have put out there, which is a review of, the first 2 really relate to having good billing processes. The next item around HR relates to, it's more of an efficiency and effectiveness process review. We're also going to look at the security and data management around non-electronic medical records. And then finally, we're going to do a departmental review of the School of Medicine. And then for 2016 and 2017, there is a list of audits, but as Hal described earlier, there's an ongoing process to monitor that, and we continue to collaborate with Office of Corporate Compliance. And as we approach those years, we're going to further define whether they're doing the work, we're doing the work, and how we best manage that. So that concludes my presentation on the plan. Any questions?
Any further questions? Thanks, Chris. And I need a motion for an executive session of the audit committee.
So move.
Is there a second? Cindy?
Curator Bradley?
Yes.
Curator Good?
Aye.
Curator Henriksen?
Yes.
Curator Phillips?
Yes.
Okay. All committee votes in favor.
And we will be in recess.
The board will be in recess and retire to executive session.